Recording in progress. Recording stopped.
Good morning, members and departmental officials. Just to inform you that the chairperson is trying to log in. She's experiencing some technical glitches. She will try to connect. The meeting will start as soon as she is connected. Thank you very much.
Thanks, Lindy.
Good morning, honorable members.
Morning, Chair.
Good morning.
Morning, honorable chairs and honorable members, and also
Yeah, we are chairs. We are chairs.
yes, you are
Yes, we
right.
are chairs.
And I'm right. Thank you very much, honorable members. And I understand that today we're going to get some presentation, 3 of them, which might not take a very long time, but we are going to ask questions. I wish to open the meeting officially and also apologize for the 6 minutes that were late with. In where I am, I'm struggling with the connection, honorable members. I'm in the village, but I've managed to log in. for the meeting. Can we then bow our heads where we are for a moment? Thank you very much, honorable members. Honorable members, let me also welcome everyone today of a special day in terms of the women. Today is our International Women's Day. I'm really apologizing for the women to get into their day. I know for a fact that there are many activities and many events that the honorable members as women have to attend, like I am also going to do that. And I just want to first say that as women, we understand how critical this day means to us and how important it is. It's worse when we talk about the economy in terms of the women. We still want to pursue and continue with the struggle to check whether can't we be allowed as women to have economic powers and have some sort of empowering the other women that are in villages that are far from where we are, and also engage them in terms of let us continue strive and fight for our rights and also our yes, we can say it's rights, not privileged, it's rights. We fight for our rights. I understand that we usually have a holiday on this day. It's just that South Africa has got many, many holidays, meaning that we are losing a lot. It's worse now that we are looking forward to the day of the elections, which we understand that these ones are not like other past ones. It's just extremely, I will say, I can't explain it, but you feel it that we are going for elections, although we used to feel it, but today and this year, you can feel that it's harder than the previous year. But we have to be strong, especially as women, because we know everything that happens in our communities, it's women. Women were, in fact, were oppressed for the triple oppressions, which we have to pass through that, and the patriarchy that is around us. It's worse with the GBV, which I cannot even explain and tell people about it because we are staying in the communities that we are faced with lots and lots. Every day when you open the TV, you get that a woman or a woman with a boyfriend is in conflict and then they fought and then he was stabbed to death or he was shot to death. So women are really experiencing. So we need to hold hands to one another. We need one another, whether race, color, or whatever. Whether you are green, you are black, you are mauve, we need one another as women. So let us take this strength for today, knowing exactly, even in all countries, they are commemorating this day. Then, if it's a case, I wanted to welcome you, feeling very, very painful, understanding what does this mean to us. And I didn't even want Lindiwe to have the meeting. I just overlooked at this date because it shouldn't be the date that we are busy sitting in meetings and boardrooms. We have to go out to other women that couldn't make it and couldn't manage to have the Lenduka. It's just that I overlooked the dates. I'm someone who's weak in looking the dates. You have to, as honorable members, to assist me in these dates because this date really, it mustn't, it was not supposed to be the one whom we are in meetings and in boardrooms. Thank you ever so much, honorable members, and also the department officials that have managed to join us today and respect this day. I'm not going to be surprised when we are told that it's not correcting, but because of its reports and presentation, maybe it's not going to hamper with us. We can continue and get this presentation. Thanks ever so much, Lindy. Can you then go to the next item of introducing who is in the meeting and who's not in the meeting? And also, we have to give over to the officials and also departments that are present to us, and tell us, Lindy, which department has joined already with us and where are we going to start. Also include, Lindy, the apologies, so as not to waste time in terms of giving you this opportunity and that one. Over to you, Lindy. Thank you very much. I welcome everybody in the meeting.
Thank you very much, Chairperson. Good morning, members, the departmental officials, the Deputy Minister Matale, and other stakeholders in attendance. Chair, today is the 8th of March 2024. There's an official committee meeting of the National Assembly, Portfolio Committee of Social Development. Chair, I wish to confirm the following members in attendance of this meeting. I have you, Chair, Member Mvana, as the chairperson of this committee. I have
Recording in
Member Stock,
progress.
I have Member Pilankulu, I have Member Mare, I have Member Hlongo, I have Member Masango, I have Member Peterson, Chair. And in terms of apologies, Chair, I've had our standing apology from Member Abrahams, who's on maternity leave. Also, Chair, Member Sukers submitted an apology to indicate that she won't be with us today due to prior commitments. Also, Chair, there's an apology from Member Fana Merve, who's attending another meeting at the same time with ours. Chair, also, there are apologies from the departments. Chair, today we'll be receiving presentation from 3 departments, namely the Department of Police, Department of Health, Department of Education, Higher Education, Science and Technology. Chair, from the Department of Police, there is an apology that the Minister won't be with us today due to prior commitments. He is scheduled to attend a physical meeting in KZN, Chair, but there is Deputy Minister in our midst that will lead the delegation, Chair. Also, there's also an apology from the Minister of the Department of Higher Education, Minister Blake Nzimande. He won't be with us today due to prior commitments. So far, Chair, those are the apologies I've managed to record. We do have officials, Chair, from the 3 respective departments. I think they will introduce themselves when they make presentation. Thank you very much, Chair.
Thank you very much, Lindiwe, our secretary, and also I've said that I've acknowledged departments, but I've never made mention of the DMs that are present with us. I also wish to acknowledge them. I apologize for not noticing that from the gadget that they are present. You are welcome, DMs, feel free. And we understand that you are leading also the departments that are with us, and you will also assist them when necessary. But let me give over to the department leaders that are present to tell us which department has just arrived, knowing exactly that the DMs are the leaders of the department, but there are officials that are delegated to do that. Over to
Sorry,
the
Chairperson.
Chair,
yeah.
Just omitted to mention that the minister just joined of social development, Minister Lindiwe Zulu, is just joined the meeting while I was busy with the confirmation of attendees. Also, Chair, we have the senior officials from the Department of Social Development as observers of these proceedings. The minister is here, Chair. Also, thank you very much.
Sorry, Chairperson.
Yes.
I just want to say, making apologies. Member Iris is going to be a little bit late because she traveled early this morning. So she will lock in as soon as she lands in Johannesburg. So I just wanted to make that apology. Thank you, Chairperson.
Okay, thank you very much, Honorable Holnitz. As I have already said that I know for a fact that there are many events today and people have to honor those events. I also wish to welcome, our Minister Lindiwe Zulu, which will give her an opportunity to also have some input, that is the political background or political overview in terms of her colleagues have joined the DMs that are with us, and also its Social Development Portfolio Committee today. So we are welcome, Honorable Minister. Can I then go to Lindy? Will you please flight the agenda of today and then tell us who's going to start which department? Then after that, after the adoption, I will give over to Minister Lindiwe Zulu. Thank you very much, Lindy. Briefing by the Department of Police. And then after that, it will be briefing by the Department of Health. And then it will be followed by the briefing by the Department of Higher Education. Then it's the agenda. And then, then it will be closed. Thanks ever so much. Then if it allows us, let's adopt the agenda as it has been proposed. Honorable members, can I get indication who is going to adopt the agenda? And also that particular person should also accept the apologies. I have forgotten and skipped that item of accepting the apologies, honorable members.
Chairperson, this is Bridget Masango. I would like to adopt the agenda and accept the apologies as having been presented to us. Thank you, Chairperson, and happy Women's Day to all.
Oh, thank you very much. I feel this day really, I've gotten sort of an emotion on it. I just feel like crying in terms of all what is happening. Thank you very much to say happy, though I know it's not gonna be a happiest one. Thanks, Honorable. The agenda has been adopted and the apologies has been accepted. Can I get the second, honorable members? Honorable Mhlong.
Greetings and thank you very much, Chair. I second the adoption of the agenda. Thank you.
Thank you very much, Yanga. Understanding exactly that it also affects you in particular, this thing of the GBV on this day of the Women's International Day. Thank you very much for seconding the acceptance of the apologies and also the the adoption of the agenda. Then if it is the case, let's proceed, honorable members, and give over to the Minister of Social Development just to have some political input on it, and knowing exactly that today is the presentation and responses to the public hearings, the questions that have been sent to them. But if they would like to also share whatever that they think it is critical for us during this era, they are free to share that with us. Over to you, Minister Lindiwe Zulu. The platform is yours.
Thank you very much, Honorable Chairperson, and all the honorable members who are on our platform again, and who are on our platform today, and everyone else who is on the platform, particularly the officials of the different departments, starting with my own department. I wish to thank them
for the continued work that they do, sometimes under not so easy circumstances, but they soldier on. And I know that sometimes we quarrel over the slow pace of things. We quarrel over why didn't we do this? Why didn't you do that? But I just feel that in the Department of Social Development, the 5 years have been pulling extremely well with challenges here and there. But I'm happy that we now are here with this particular topic that we have. I also want to follow, as indicated earlier on, that it is the International Women's Day today, and Honorable Masango reminded us of that, and to request that as women consistently we have to keep on uniting around the issues which concern women. We have to consistently join the global world of women who do everything they can, those who are in leadership positions and all that, to try and push the agenda of women from an African perspective. And we in South Africa are counted among those women that have done a whole lot of good work, both inside the country, but in the region as well as the African continent. I wish to thank the women who always stand up to defend other women, who always stand up and ask that we be counted as human beings, we be given the rights that we deserve. Let us create the conducive environment for women to thrive. Chairperson, I don't want to be making any further statements. I just thought, let me also just take advantage of the March 8th and its history and how we got to be even where we are ourselves as South African women, and wish all the women who are in the platform a very good day. I don't know in other parts of South Africa. In Johannesburg is beautiful and sunny. And I'm wishing also the women, older women who are part of the reasons why we are here today. And I'm hoping that the public hearings will always enrich our process of drafting and writing and finally approving of legislation, because we are in this together, not for any other thing, but the creation of a conducive environment for our people to thrive. And older persons, it's our responsibility, it's our duty to ensure that they are taken care of. But most importantly, I want to say, yesterday I was in Mpumalanga. The president had a presidential imbizo. And I must tell you again, the majority of people who always turn up to these imbizos to speak, most of the people who spoke also yesterday were the older people. And in particular, a lot of women spoke there, voicing their concerns about their conditions, voicing their concerns about the worries because young people are no longer taking care of them, voicing their concerns that, yes, government does give them the grant and all that, but that money ends up being spent on children and grandchildren. So I want to close by just indicating, which I'm speaking to people who know anyway, that's important for society to take care of older persons because they've contributed so much. They still contribute a lot to our communities. And as they need to live well in their golden years. And I'm hoping that as a government, we'll continue consistently to look for the best way of creating and improving the environment under which they live. Thank you for giving me the opportunity, Chairperson. I will be here as much as I possibly can, but I think at about 9:30, at 10:30, at 10:15, I will have to step up because I'll be getting into another meeting. But I'm wishing the meeting and wishing everybody well. Thank you.
Thank you, Minister, with those encouraging and also motivating words. We are also motivated this morning. We would be excused when it is necessary. The only thing that I would like to say, honorable members, excuse me, if the what is this? The network kicked me out or can you kick me out? I know for a fact that I've got a whip who's present here. He will take over the meeting because I've got a network problem, and also I am driving to these meetings that we're talking about. Thanks ever so much. Then can we then give over to the DM or the department that's going to start, which I know for a fact that it's the police according to our agenda that has been adopted. And the DM is present with us. Can we give over the platform to the DM?
Good morning, Chairperson. Good morning, members of the committee. Good morning,
DM.
Minister of Social Development, Minister Zulu, and your team, and my colleagues, other DMs that are connected here, and other departments that are going to appear before you. We are here with a team. You have the meeting. I think the Secretariat has already submitted our apologies from the Minister and the National Commissioner who are on other assignments in KZN. We are here with General Sintumule, who's Divisional Commissioner for Detectives and Forensic Services, which is relevant to the issues that we are dealing with. And we also have Lieutenant General Zulu, who's Divisional Commissioner for Human Resource. And we also have Major General Van Rooyen, Acting Divisional Commissioner for Legal Services. We have General Pinar, Component Head, Proactive Police Service. We have Major General Matonsi, Component Head, Social Crime Prevention, and Major General Sabula, who's Head, the Executive Support and International Relations. Brigadier Matros, Acting Component Head, Corporate Communication License, and Brigadier Malachela, Section Head, Executive Secretariat, and Lieutenant Colonel Mulambo, Parliamentary Liaison, Strategic Management, and Captain Mudisa. Those are the delegation from the South African Police Service, but we also have Mele Dwaba, who is representing the Civilian Secretariat for the police as part of the team that is here today. We are very much keen and interested in participating in these processes and making our own contribution as the South African Police, and we are happy that the committee have adopted an approach of inviting not just one department, but other departments, so that we can have an approach that is interdepartmental on dealing with issues of older persons. We find that an approach which is interdepartmental, it assists. It does not make it a problem of social development or a police problem. There are other pieces of legislation, Chair, that have been passed wherein they rest in one department, but sometimes the South African Police there is expected to play certain roles. For instance, issues of those that have mental health. Police are expected to take such people to a place where they get treatment, that's in a hospital. But when they arrive there, they are told that there is no bed, and that it becomes a police problem. Then the police must take a person with a mental problem to a police holding cell, which is meant for criminals. So we find ourselves in instances like this, and we so wish that even in this regard, as the legislation is put through Parliament, it must be crafted in such a manner that where police are expected to come and play a certain role, it should not be a role that at the end the legislation does not talk to what happens in a situation like, for example, I have given an example where we take a person to a hospital and we are told there is no bed, and therefore it becomes a police problem. And the legislation is crafted in such a manner that there are no options on how such a thing can be handled without it becoming a police problem. Like in this case, we are dealing with older persons. The legislation must be crafted in such a manner that it does not become a police problem, while initially the police were coming to make it possible for social development to deal with the problem that they are confronted, that an elder person is confronted with. I know sometimes it will not be feasible to have a watertight legislation in that regard. We will have instances where we'll find ourselves in such a situation, but I think it will be important that as lawmakers, we do things in such a manner that we don't create an unintended a consequence that is unintended, which becomes a problem to another department. But we're happy to be here, Chair, and to make our contribution. And if you may allow, I will request that through you, General Sintumule can lead in the presentation that we have, or anyone amongst the team who is assigned to do that responsibility. If you allow, I will request General Sintumule to come in. She might even introduce others that I might have omitted by mistake. Over to you, General Sintumule, through you, Chairperson.
I allow you, DM, to do that, understanding that all what you have said, it's the reality at the end of the day. So you can delegate the responsibility to your department.
Thank you very much. Thank you very much, Chairperson. General Sintumule.
Thank you very much, DM. Greetings to the Honorable Chairperson and the Portfolio Committee members, recognizing Minister Lindiwe Zulu, and greetings to our Deputy Minister, Castle Matale, and all the accompanying reps from SAPS, all the DGs on the platform and colleagues. DM, I won't waste much time. I'm going to ask that General Matonzi take over and lead us in the presentation. Thank you, Chairperson.
Thank you very much. General, let me first greet the Honorable Chair of the committee, the honorable members.
Chairperson. Chairperson.
Yes, hello, Honorable Kate Bilangulu.
Chair, can't you ask them please to open their videos when they are presenting so that we can also know them, because we don't know the people that are with us today.
Yes.
Thank you.
Yes,
Just for
I
a while.
thought so. Yeah, just for a while. I can't remember the portfolio. I mean,
No, it's okay, Chair. We will comply. We'll comply.
Then just open it up and introduce yourself, and then close it, because we know that it also impacts on the network.
No, we will.
Thank you very much. Okay, thank you very much, Honorable Kate.
Thank you. I have opened my video, but I don't know whether I'm visible to members, because I can't see it myself.
Yes, we are.
You are visible, DM.
You are visible, DM,
okay.
except your
Thank
finger.
You very much.
Your big finger has also impact on the screen. Thank you.
No, thanks very much. I will request General Sintumule to open her video and just request General Matonzi to present. General Sintumule.
Thank you very much, DM. I hope the members can see me. Once again, let me thank the chairperson, and without wasting much time, hand over to General Matonzi, who will lead us in the presentation. Thank you, Chairperson.
Thank you very much, Lieutenant. Let's allow you to delegate the responsibilities.
General Matonsi.
Thank you very much, Honorable Chair. I've switched on my video so that the members can see. I will now switch off and continue with the presentation. Let me first greet the Honorable Chair of the committee, the Honorable members, our Minister, Minister Zulu, our Deputy Minister, Mr. Matale, and all other DMs present, our two divisional commissioners who are present, Lieutenant General Sentumule, as well as Lieutenant General Zulu, senior officers from SAPS, and all departmental officials, and all protocols observed. Honorable Chair, today we are presenting a response to the letter that was received by the department, where there were issues around the concerns that were raised from the public, but also as well as the comments into the amendment bill that is being crafted. So our presentation, as someone is controlling for me, if we can move, our presentation will cover three main aspects. The first one, we want to highlight the current directives of the department, which were informed by the current Act of 2006. And then secondly, we also want to highlight our comments in terms of the amendment bill. And then lastly, we will then respond to specific issues and recommendations that were raised by the public. So that will be the approach for our report this morning. We can move to the next slide. As SAPS, I just want to indicate that based on the current legislation or the Act of 2006, we have various directives and guidelines and national instructions that are guiding our members at the station level when they're dealing with the victims. But also those directives also cover the issues of treatment of specific victims, including the older persons. We also have directives that guide our members in terms of the treatment of victims of domestic violence, as well as victims of sexual offenses. But with regard to the older persons, we also have a specific guideline that also, or a national instruction as we call it, on the protection of the older persons. So I'm now going to go through this guideline just to highlight what provision that they made and what guidance do they provide to our members. We can move to the next slide. So let me just get this right. The first directive, Honorable Chair, that we want to present is around the victim empowerment, which was crafted in 2014. We refer to it as a National Instruction 2 of 2014 on victim empowerment. Basically, this directive, it gives effect to the service charter. In other words, it provides us with the minimum standards in terms of how we deal with the victims of crime when they come to the police station. In the main, it emphasizes the protection and the promotion of the rights of the victims in compliance with the Act currently of 2006. But it also makes provisions for the special arrangements to be made for victims of crime with special needs, because we'll find victims with challenges with sign language, others might be the physical access into the stations, etc., etc. So this directive specifically, it's our policy document that guide our members in the front line at the station level. Also, this directive as well, it covers the issue of the victim-friendly rooms, which are the facilities that were created in our stations to accommodate victims of certain sensitive cases to ensure that they are interviewed in a private space. And this directive also emphasizes the treatment of victims with sensitivity, dignity, care, and respect, but it also encourages the stations in particular to promote or to ensure that there are effective partnerships with the local organizations such as the civil society, NGOs, etc., etc. It also manages the issues of volunteers. We know that in our victim-friendly rooms, we do have volunteers who provide some social support to the victims, especially victims of sexual offenses, including any other victim who falls under the group that we refer to as a vulnerable group. You can move to the next slide. And then we have the next directive, which talks to the older person treatment of older persons, which is National Instruction 1 on 2014, which deals with the protection of the older persons. This directive specifically, Chair, it regulates the powers and responsibilities of the police officials. A specific emphasis is placed on the treatment of the older persons. It emphasizes the respect, protection of the rights, as well as the ensuring that the older persons and all the vulnerable groups are treated with dignity. It also guides the members in terms of treating the older persons fairly and equitably, but also protecting the older persons from unfair discrimination. These are the policies or guidelines that the members follow when they are supposed to follow them when they're dealing with the victims at the station level. Can we move to the next slide? Still continuing with the same National Instruction of 2014, police officials are required in terms of these directives to be mindful of the older persons. So we are guiding them in terms of saying that the older person may not behave in the same way as a younger person. For instance, the older person might, depending on the condition, might not have a proper hearing condition, or physically the person might not be able to move properly, but also an older person may need to be interviewed in a private space. So this policy is about that, to make sure that members treat the older persons in the best interest, for instance, interviewing them in a private space or allowing them to sit. But we also encourage in terms of this policy that members should not humiliate or intimidate an older person, but also to protect the privacy and the dignity of the older person. You can move to the next slide. And then we also have directives in terms of the victims of domestic violence. Chair, I'm not going through line by line. I'm summarizing because the report was shared, but also given the fact that the time is limited. In terms of the domestic violence, also there was an amendment of the Act, as we all know in this platform. There's a new Act signed in 2023. In terms of that legislation, there was an expansion in terms of some of the matters, which then now includes the spiritual abuse, elder abuse, coercive and controlling behavior. And as a department, we are in compliant with this Act. But to make sure that we fully comply with it, we also amended our guidelines of 1990 to cater for these additional changes in terms of the legislation. But over and above that, we also gave the directive in terms of the station commanders to develop what we call the local station orders. The reason why that is important is because our stations are almost all different. They range from the smallest to the biggest station, but other stations are rural, others are township, others based in the informal settlement. So we always encourage that there are also local station orders that apply to specific stations. For example, the station need to have their own local arrangement in terms of how they interact with the local shelters, how they communicate with the local professionals. If they need a social worker, what are the protocols? So they make those arrangements locally, but also if they need access to help, what are the protocols locally? So we always encourage stations to do that at a local level. But over and above that, the station orders also require them to also form some liaison with other government departments, social development being the critical one, but also the other stakeholders such as Community Police Forum and all other institutions that are relevant to the CJA process that we undertake. Can we move to the next slide? The police officials, in terms of this directive on the domestic violence, that they must inform the compliance of complainant or the victim of the services that are available, as well as how to access those services. So the critical role for officers, which will be the same with the older persons, to make sure that the victim is informed in terms of what services are available and where to get assistance where is necessary. But also to assist the complainant to obtain the medical treatment. So the officers also have that responsibility in terms of this directive, and also to assist the complainant or the victim to find a suitable shelter. So those are the critical roles that the police plays in our front office at a station level. Can we move to the next slide? In terms of the treatment of victims of sexual offenses, in terms of the directive, the important thing in this one is that we sensitize members in terms of people who are victims of sexual offense trauma, and therefore members need to be mindful in terms of how they treat them. We say victims must be treated in a sensitive manner due to their condition, and the interview must also be conducted in a space. I'm going to come to this one at a later stage because we do have victim-friendly rooms which we utilize for this particular purpose. Can we move to the next slide? The officers, in terms of these victims of sexual offenses, they're required to, once the victim has come through the CSC or the front office, is to take them to an appropriate area or the private space for that person to be interviewed, but also to provide reassurance to the victim, and also to determine and support them in terms of getting the medical assistance when it's required. And normally in practice at the local station, there will be agreements or arrangements with the health department locally in terms of what facilities are utilized. In some cases, obviously, we'll have Thuthuzela centers as well, which are also very, very helpful. But also we encourage members to listen to what the victim has to say and to make sure that they treat them accordingly and provide the assistance that they may need. Let's move to the next slide. In terms of the crime investigation, for detectives, we also have a directive of 2017 as well. But the important thing here, Chair, to stress on this particular one is that detective services or investigators, they investigate all cases that are reported and registered. If a case requires a special unit, then the case will be referred accordingly to that particular unit. Like for instance, as we know in this platform, we have FCS, Family Violence, Child Protection and Sexual Offences Unit, which specialize with these cases. If a case falls within their mandate, they will deal with those cases, but the station will make those references once the case has been opened. But also if the case involves the family, then it also will be dealt under the Domestic Violence Act, depending on what crime was committed. But just to stress on this particular one, that detective services, they investigate all cases. And I think that's one of the things that as a department, Chair, we encourage all the time during our awareness and Izimbizo for the community to report crime. Because the starting point for detectives to start investigating is that the case must be reported or the case must be registered with the police. So I think that is important. But once it's reported, whether it's an elder person or younger person, then the investigators will start investigating that particular matter. Let's go to the next slide. Then the next part, which is part 2, is our comments around the amendment bill, starting with clause 3, which talks about the implementation of the Act. We want to start by saying that, Chair, we welcome the formalization of the interdepartmental structure. And for us, it's very, very important. That coordination between different departments and stakeholders is very, very important. I think our DM already touched on this one. I'm not going to repeat it, but it's important that when we have a victim as the police, the facilities are available to keep that person, because we avoid a situation where we keep a patient, like for instance, in the case of the mental health care users in the cells, which is not really suited for patients. So I think that is very, very important. So we encourage that coordination and collaboration for us is very, very important. But we also want to stress that we also, the implementation of the Act obviously will require a concerted effort by all the departments. The bill or the legislation will require that we have a seamless approach, so that as the victim moves from one department to another, there are no problems. We are able to accommodate and make sure that they don't get exposed to secondary victimization. If you can move to the next slide. Our comment on the removal of the older persons with temporary safe care, which is section 25A, subsection 1 provides that police official must remove an older person with her consent or his consent, or concern of an authorized person. So our comments was that there is no definition provided in terms of who will be the authorized person. So that can create problems for a police officer on the field if he is not sure who actually is an authorized person and he has to make decisions right there on the scene. That will be a problem for us. In terms of subsection 3, police official who has removed an older person must inform the family. Again, we are saying it is unclear how this information may be obtained, as indicated that if the victim is incapable of consenting and we don't know who is an authorized person, that can create a problem even to inform the family if you don't know where the family is. So we are saying it's one of the areas that also need to be looked at very, very closely. But SAPS in general, we are concerned about the practical implications of the proposed amendment. Department of Social Development is primarily responsible for the welfare of older persons, and our submission is that they should therefore be leading the process. The bill also is silent on where the police officer should take the person once it's removed, as indicated that if that space is not available, the option that will be left with as police officers will be to keep a person in the cells, which is not necessarily suited for keeping a sort of an older person, especially for victims, is made for suspects or criminals. This is coming from our experience with the mental health care users, where we've experienced a lot of challenges in terms of finding the right space to accommodate them, and we find ourselves keeping them in our police cells, which is also a challenge in terms of law to do that. So what we are saying that as a department is that the administrative matters relating to the location of the family and the placement should be the responsibility of social development. So those are our comments as far as this clause is concerned. Let's move to the next slide. It's still on the removal, but going to subsection 7. It provides for the misuse of power by a police official that it will constitute grounds for disciplinary proceedings. Our comment is that it is unclear what is envisaged by misuse. I think it just needs to be clarified so that we know when does it become misuse. But over and above that, as a department, we are saying we already have our SAPS discipline regulations of 2016, which deals with the failure to comply with an act or regulation or any other legal obligation. We're therefore recommending that this section should then be removed. It is not relevant because it's already covered in terms of the other prescripts that exist. That's our comment on this particular one. We can move to the next slide. Clause 18 around the prohibition of abuse of older persons and special measures to combat abuse of older persons. The amendments to section 30. The proposed amendment of subsection 3A, it expands the definition of physical abuse. It now includes neglect and exploitation of an older person in any manner. This implies that physical violence is not a requirement for physical abuse. It is therefore proposed that the wording rather be inserted as below. For the purposes of subsection 2, abuse includes physical, sexual, psychological, and economical abuse, or the neglect or exploitation of an older person in any manner. So that is the input that we are suggesting as a department. Let's go to the next slide. Now we deal with the specific issues that were raised by the community. We'll deal with them one by one. The first one is the lack of seriousness in handling cases of older persons abuse. And the recommendation was that we advocate for police officers to uphold the rights of older persons and treat such cases with agency and sensitivity. Honorable Chair, our response on this one. Yes, Chair.
No, proceed, General.
Oh, thanks.
Proceed.
Hello.
Thanks.
What's the problem?
May you all be muted because you are disrupting the presentation, please.
Okay, thank you.
Thanks very much. Thanks, Chair. Chair, on the first issue that was raised around the seriousness, our response, as I've already covered this, that we currently have a policy on protection of older persons, which emphasizes dignity, rights, non-discrimination, and assistance to older persons. So that policy it covers all the issues that were raised in this particular case. But over and above that, Chair, we also have the guideline focusing on policing of crimes against older persons. And these guidelines were developed in consultation with the relevant stakeholders. So we developed them with stakeholders to make sure that they cover all the issues and they are sensitive enough to the challenges and experiences that the older persons have had in our stations. But also as part of the preventative options, we also work with the Community Police Forum in this particular case, but also other relevant forums at the particular stations. We also have a what we call a station profile that will indicate what facilities are there. And the only thing that we will not have is probably the number of older persons in the area, but we'll know what facilities are there for the older persons in each and every area, but also we'll conduct regular visits to older persons institutions. I think maybe one thing we need to maybe enforce, Chair, at this case is to make sure that those regular visits are done, and also that the older persons in those facilities are sensitized and engaged to make sure that their challenges are understood more. We can move to the next slide. The next issue was around the lack of respect for older persons at the police stations. Again, that is also covered by our guidelines of 2017, again, which provide for guidance on respectful treatment of the older persons. And as far as the queue management, we also have a directive there that prescribes that when a victim comes into the station with special needs, that person needs to be assisted or prioritized. Like an elderly person will not stand in the queue and wait to be assisted. That person will be prioritized and brought forward so that he or she can be assisted. But also the establishment of forums for older persons. I think one of the things, Chairperson, which is currently not in place, maybe we'll look at how we incorporate older persons structures into our community police forum and see whether they can play our role, so that they can also maybe submit any additional challenges that they may be experiencing at a local level. Let's move to the next one. The next issue was around the absence of private rooms for opening of cases, especially for sexual assault. And the recommendation was to advocate for the provision of private rooms in the police station. Chairperson, I think on this one, what I want to stress, Honorable Chair, is that we do have designated victim-friendly rooms, at least in 1,021 police stations. And for those stations that don't have standalone facilities, we do have alternative arrangements where we'll have a safe offices site, which is utilized to interview victims especially of sexual offenses and all other sensitive cases. But also over the last 2 years, Chair, we have established what we call GBV desk, which are the desks that are meant by our members who are extra trained in terms of dealing with sensitive cases. And they also work closely with social development in terms of accessing professional assistance. So we do feel that this particular issue it's fully covered currently from a police station point of view. Let's move to the next slide. As far as insufficient training for police officers in dealing with older persons, the recommendation was a call for comprehensive training programs to educate police officers on the unique needs and challenges faced by the older persons. I've covered the guidelines that guide the members, but I just want to stress that we currently have different programs or training programs or learning programs that support or train our members as to how to deal with the vulnerable groups. The first one being Vulnerable Groups Learning Program, which focused on the protection and provision of services to older persons. So that program, it covers that. The second one is Victim Empowerment Learning Program, which again, it addresses the issues of victim empowerment, victim support, and all the relevant support that is required. We also have Domestic Violence Learning Program, which focus on domestic related issues. And then we also have a First Responders to Sexual Offenses Learning Program. So these programs, there are also other programs such as the human rights as well, which are covered in other modules. But these are core programs that we feel that they provide sufficient training for our members to deal with older persons. But also lastly, Chairperson, we want to commit to say that obviously training is an ongoing process. Once the bill or so the new legislation has been enacted, we'll obviously relook at our training programs and make adjustments where it's necessary to make sure that our officers remain relevant. You can move to the next slide. The next slide was around, the issue was around the lack of sign language interpreters at police station, and the recommendation was to suggest the availability of sign language interpreters to ensure accessibility and inclusivity for all older persons. As a department, the chair, we signed an MOU with DEFSA in 2020, which basically assists us in terms of supporting those people with sign language interpretation. So they provide us with the services free of charge. So if a person comes to the station and the sign language is required, we will make a call and get someone who is on standby from DEFSA to assist with us in terms of that. But over and above that, we also have trained our own members by our division, Human Resource Division. That's why Lieutenant General Zulu is here as well. We also train our own members. As to date, we have trained about 1,791 members. But of course, it is a basic sign language training. It may not be the advanced training like what we get from DEFSA. But lastly, as well, we're also exploring the technology because what happens, Chairperson, is that when we train our members, we give them the basic training, but because they don't utilize the sign language every day, you may find that they start losing the understanding of the language over a period of time. So hence we're exploring the technology to see whether we can tap on technology and be able to deal with this particular challenge at a station level. Can we move to the next slide? The shortage of temporarily safe care facilities for abused older persons. The recommendation was that the expansion and improvement of temporary safe care facilities to provide adequate support and protection for abused older person. On this particular one, Chair, we work closely with the Department of Social Development as a lead department in the provision of the facilities. There is a good collaboration with the social development at all levels. However, as I indicated, the challenge is if the facilities are not there. And I think that's why we're stressing when we're making our inputs in terms of the amendment bill, in terms of the provision of the temporal safe care for older persons. That is important that these facilities are important. And we think that it is important that I want to stress, which we touched before, that social development deals with all the admin matters as far as the removal of offenders are concerned, as well as the availability of care facilities. I think DM, Mr. Matale, stressed on this particular issue in terms of ensuring that the facilities are there when we arrive with a victim. But also should be a regular assessment of the availability and suitability of safe care facilities, because areas differ. I think the big cities and maybe big townships will find that the facilities may be available, but the deep rural areas and other small areas, they may have challenges. But also the assessment is also important in terms of ensuring that when we hand over a victim there, we are also we also believe that the space is appropriate, the space is safe in all respects. So hence it's important that the assessment, the regular assessments are done of these facilities to make sure that they remain suitable to take these the victims into those places. Can we move to the next slide? The lack of legal protection and support for older persons. The recommendation was the call for enhanced legal protections and support services for older persons. As far as SAPS is concerned, I've touched on our national instruction of 2014 for the protection of older persons, where it sets out what are the duties and responsibilities of our members. Our members are responsible to protect and promote the rights of the older person, also including those who are victims of crime. But I must indicate at this point, Chair, that as SAPS will not necessarily provide legal services per se, but our role in the main is to make sure that we do the referral of the abused older person, make sure that the person is referred to the right facilities, also make sure that the person is safe by protecting his right, and make sure that he doesn't get victimized again, make sure that the person is referred to relevant professionals if medical attention is required. We also have a responsibility to make sure that we support the person and make sure that the person gets those rights, but will not necessarily provide the legal services per se, but only the advice as well as the referral. So I think that is what is important on this one. If we can move to the next one. And then in conclusion, Chair, I want to say that as a department, we acknowledge the concerns that has been raised, and we are confident that the current directives and guidelines do address a lot of issues. But however, we also need to look and maybe assess in terms of compliance in all the stations and see that all the stations are in full compliance with our directives. We do that, but obviously we're unable to reach every station every year. But we will intensify in terms of those inspections to make sure that they comply fully. As SAPS as well, we are committed to ensuring the protection and the promotion of the rights of the older persons. And even in those cases where we don't have victim-friendly rooms, currently our supply chain is working on a contract to make sure that they are built over the next 3 years or so. So to make sure that those private spaces are available and proper in all the stations. I think going forward is important, as we want to stress that there are clear protocols to avoid a situation where a person cannot be accommodated because the facilities are there, and we end up putting those victims into ourselves. And we learn this in a bad way with the mental health care users, where health could not accommodate them, or sometimes where officers have to drive 300 kilometers to get health facilities, which actually put some strain on our resources as APS. So I think it's important that those protocols are in place and the process is as seamless as possible. Chair, thank you very much for the opportunity.
Chairperson? Chair?
Thank you, Chair. That concludes our presentation from the police. Thank you, Chair.
Okay, thank you very much, DM. And then DM, we would like to request you to allow the second presentation be done, and then we can ask questions of clarity. Otherwise, we appreciate and welcome the presentation. Thank you.
Thanks.
Can we then give over to the next department, and then we will discuss and deliberate as committee members after this second one. Thank you very much. Over to you, department.
Thank you very much, Honorable Chair, honorable members. May I also recognize the Minister Zulu present here, Deputy Minister Matale, and all the colleagues that are in the meeting. Let me introduce myself. My name is Sandile Buthelezi. I'm the Director General of the National Department of Health, and also just pass the apology on behalf of my minister and my deputy minister, who might join us as he is in transit. I'm leading the team that is representing Minister Pahla, and that team, the presentation will be led by Ms. Jeanette Hunter, who is the Deputy Director General responsible for primary health care branch within the National Department of Health. Then she's supported by Itu Njeka from the department. With your indulgence, Chair and honorable members, may I hand over to Jeanette Hunter to lead the presentation. Thank you very much, Chair.
Good morning, Chair and honorable members, also the leadership from government and my colleagues from government. Thank you for the opportunity to present the department's response to the communication received from the Portfolio Committee. I will now close my camera and continue with the presentation. I am struggling to move my slides. Chairperson, are the slides visible?
As the committee secretary, we can see the first slide with contents. It's visible.
Thank you very much. So we will just give a brief background in terms of the Department of Health's responsibilities when it comes to the health and care of older persons. And then secondly, we'll provide our response to the communication received from the Portfolio Committee on Social Development. And in that response, we address the issues raised during the provincial public hearings and also the recommendations made by the committee. In terms of our background, we are saying that we do address the core functions of the geriatric program in the National Department of Health, and those of healthcare to older persons, to protect and promote the health rights of older persons through multi-sectoral collaboration, because the older person's needs are complex and it spans across departments, and our key departments being social development and also the NGO sector and civil society. To further improve current health services to older persons, the National Department of Health is in the process of developing a national policy framework to update what standard operating procedures we have had before. And the first draft has been completed and will be finalized after consultation with provincial departments, other government departments, NGOs, and civil society. The issues that was raised in the provincial hearings are as follows. The participants communicated that there's poor service delivery at local health facilities, that older persons stand in long queues with no shelters, chairs, access to water and ablution facilities, and that they are often attended to last because younger people push older persons out of the queues. That our facilities are often short of medication, that older persons have to travel long distances to access healthcare facilities, that healthcare professionals are not trained on how to deal with older persons, that healthcare professionals do not visit residential care facilities and service centers for older persons, and that this results in services such as dispensing of medication and the provision of diapers as not rendered. Also, that there is a lack of understanding and knowledge by older persons and communities at large about communicable and non-communicable diseases, and that because of this, elderly people who suffer from dementia, for example, and their families are not trained and educated on how to provide support to them. And this often results in older persons being targeted because they are blamed of practicing witchcraft. Chair, we respond to these one by one. And the first one is about the poor quality of services at healthcare facilities. Our response is that the National Department of Health, in collaboration with provinces, is implementing the Ideal Clinic, which progress to Ideal Health facility framework, and we progress to the Ideal Health facility to include our district hospitals in this framework. And this framework has been implemented to address the quality in general. Element number 12 of this framework speaks specifically to how very sick, frail and older persons should be received and treated in our health facilities. The provinces, with guidance from the National Department of Health, have instituted a complaints mechanism at health facilities, and we also have a national toll-free number. So in the next two slides, I just present specifics out of the framework for the committee's information, that we actually developed manual to improve quality of services at our health facilities. And the manual we provide as hard copy to the facilities, but it's also available on anyone's cell phone through the App Store as an app. And our portfolio committee, the Portfolio Committee on Health, actually finds this manual very valuable because they use it as a tick sheet when they inspect our primary healthcare facilities and our district hospitals to see if practices within our facilities meet the standards set in the Ideal Clinic framework. And they also find the app on their phones very useful because they don't have to carry any papers, but they always have their cell phone with them, and then they check that the services adhere to the prescripts of the Ideal Clinic framework. So within this manual and in this framework, there is this printout which facilities has to print and put up. And it says, please note that very sick, frail, and elderly patients will be given priority and move to the front of the queue. We do accept that these practices may not be happening at all facilities, but I address this in a later slide, Chairperson. Just to carry on to provide information on the framework, when you look at the SOP related to this element 12, that says there is a process that prioritizes the very sick, frail, and elderly patients, we've actually put out step by step to the facilities what they are supposed to do. So no one can claim ignorance of how older people need to be treated at health facilities. And step 1 says schedule a monthly roster, duty roster, to assign staff to the help desk and the reception. Ensure that the various languages spoken by staff at facilities are documented and available at the help desk. And so that staff could be called in their own languages, and also that there's also interpretation. Not staff called, that patients should be called in their own languages and addressed in their own languages, and that there is interpretation where necessary. This is important to us because the reception is the first impression that we make on the patients that we receive. And we want people, including older people, to be greeted in a friendly manner so they immediately feel at ease when they walk into facilities. Step 2 says that in line with this prescript, the facility has to develop a standard operating procedure that prescribes how frail people, including the elderly, are supposed to be prioritized. They must display a notice in at least 2 local languages in the waiting area indicating this prioritization. And they must schedule in-service training for all staff on this prioritization process. They must delegate the function of the prioritization process to a designated staff member to make sure that they check on a daily basis that this is adhered to. The person in charge must conduct random spot checks during the day to determine if the very sick, frail, and elderly persons are being prioritized. We move to the second point that was brought up by community members during the hearings, and this is that our facilities are often out of medication. The Department of Health has a stock visibility system. It's been called SVS for short, and this monitors from the national level the medication available in the facilities on a weekly basis. We find that the tracer medicines target is 90% and the current stock availability is 96%. The word tracer medicines just describe the list of medication that must be available at the different levels of health facilities, meaning at clinics, at community health centers, district hospitals, and higher level hospitals. There's a different list in terms, and that is supposed to address the complexities in terms of conditions that the different levels deal with. We are aware, Chairperson and Honourable Members, Honourable Chair and Honourable Members, that from time to time some facilities do run out of stock, And we usually ask that it's reported as soon as possible, and such facilities can be helped by other facilities in the same district that has the medicine, or in the same province if a district is struggling in general with a particular medication. The issue about older persons traveling long distances to access healthcare facilities. We have instituted a procedure called CCMDD, which stands for the fact that we have a central chronic medication distribution system, which then assists us to call our older and patients who are stable on chronic medication to come to the facilities only once in 6 months. And then we do provide mobile clinics where a fixed clinic is situated more than 5 kilometers from a community, more than 5 kilometer radius from a community. The point made that healthcare professionals are not trained on how to deal with older persons. Again, the National Department of Health has a program called Adult Primary Care Training. And we train all health professionals, but with a focus on doctors and professional nurses on this program. And it's called Adult Care Training because it spans from the lifespan of someone who is 18 years and older until the last years of life, in terms of different conditions affecting the human being during our lifespan, and to be able to give that care. And the care of older persons is included in this training. There's different training for persons younger than 18 years and, of course, children and babies. Healthcare professionals do not visit residential care facilities and service centers for older persons. This results in services such as dispensing of medications, provision of diapers, and other medical services not rendering. Honorable Chair and honorable members, we have to admit as the National Department of Health that this is a weakness and that we have to strengthen this area, but it will have to be done in conversation with the Department of Social Development and NGO partners, since these institutions are registered with the Department of Social Development, and we'll really have to deliberate on this and decide what exactly the Department of Health's responsibility should be in this regard and how we should then execute that agreed upon responsibility. There is a lack of understanding and knowledge by older persons and communities at large about communicable and non-communicable diseases. Specifically refers to misunderstanding around dementia, and then also the stigmatization and victimization of persons suffering from this condition through being accused of practicing witchcraft. So, although we're describing here what we do specifically in this regard, but we also admit that we could probably do better and ensure that there's further improvements, especially in conditions like dementia and Alzheimer's that affects how people act in their daily life. So we are being assisted by the Association for Dementia and Alzheimer's, and they collaborate with both the Department of Social Development and with the Department of Health at provincial level, where they run awareness campaigns and provide training to family carers and the community at large. There are also health awareness and health promotion campaigns implemented by the provinces, but we will have to look, Honourable Chair and Honourable Members, at our coverage as the National Department of Health in terms of community training, and probably do much more through community radios and TV shows and other mediums used more regularly by older persons. Chair, we move on to the recommendations that was made during these hearings, and the first one was that more mobile facilities should be made available especially in rural areas and farming areas. And our response is that mobile facilities do exist, but their route probably needs to be communicated to communities again, I think through community radios and local newspapers. And the provinces do regular assessment in this regard to look at the coverage, and they increase the clinics and mobiles as their resources allow. Number 2, Chair, was a recommendation that the Department of Health should train and educate communities, families, elderly people, and caregivers on dementia and Alzheimer's disease to stop violence against older persons who have these diseases. I've previously spoken to this, Chair, during the comment section, so I will not repeat it, but just to say we are fully aware that we should do better in this regard. The Department of Health should have programs dedicated to the older persons and exonerate the elderly from queuing in public healthcare facilities. Our response is that the Department of Health, as expressed in element 12 of the Ideal Clinic Manual, do prioritize older people, and it's clear that older people should not be queuing at health facilities, especially primary healthcare facilities. Because, of course, once you get to hospitals, it will depend on the emergency medical responses in terms of the urgency of certain conditions, because bigger hospitals often have to treat trauma cases. The National Department of Health will run community education and media campaign about this, since the comments during the provincial hearings indicate that this is not pervasively practiced by staff and not pervasively known by older persons and their families. The centralized chronic medication dispensing and distribution program of the National Department of Health also prioritizes older persons. Another recommendation is, and I think this is the final recommendation, says there should be sign language interpreters at healthcare facilities. Our response is that this will require additional resources, which the NDOH does not currently have, but this is an important point, and we will definitely cost this intervention in terms of different modalities that could be applied to help persons needing to communicate in sign language, so that we can motivate for the funding and implement this at our health facilities. Chairperson, in conclusion, we are saying that poor quality in our health facilities is not pervasive, but that regrettably there are incidents of sporadic poor treatment of patients. We encourage the users of health services to complain when they do receive poor service, and we receive many complaints through the presidency, through the minister's office, through the DG's office, also on our complaints hotline. And when we receive these, we do act decisively where there is a systemic problem. For example, if there is a weakness in terms of availability of medication, we have to find out what the problem is with that particular facility, because medicines are not a general, there's not a general shortage in the country for medicine. So if there's a shortage at a particular facility, there's usually a problem of maybe distribution that needs to be resolved within the system. The facilities also have to render redress to patients and families that were poorly treated. We act by correcting whatever systemic weakness has led to the poor service received by clients. And we also continuously train and retrain staff. And then, of course, at the end, if all this has been done, but there's willful neglect in terms of treating all patients, including older persons well, we do need to move on to disciplining staff. So it's a continuous quality improvement process, Chair. We could never rest on our laurels. We need to act, and also not just on complaints, but we have an active supervision system at our facilities that must pick up weaknesses and act appropriately in terms of strengthening the weaknesses. Chairperson, thank you very much again for the opportunity for health to present. We also thank the committee for communicating to us and making us aware of how the public feels about our services so that we can continue to strengthen South Africa's health system to provide better services. Thank you, Chair.
Thank you very much, Department of Health. Then now it's engagement and also deliberations by the committee members. Thank you. We appreciate the presentation from your department. Honorable members, can we then get into the discussions? Start by presentation number 1, the one of SAPS, and then get into the second one. Or you can mix and ask all the questions once and for all. Then health will take hers, and then the SAPS will take theirs. I can see the hand of Polnit and Honorable Bridget. I will also await for the other hands. Okay, let's give over to those two.
Thank you so much, Chairperson. Chairperson, I want to thank everyone that is here, the Department of Police, the Department of Health, on the Older Persons Bill. Chairperson, the Department of Police has given all the abuse, but the financial abuse is not there. Older persons are being abused by their children and grandchildren. Whenever they get their grant money, their social grant money, the children are taking these people's money. The grandchildren that's on drugs steal the Oma and Opa's money. And the police is not very assistant when it comes to the older persons. There must be a special desk. Can I continue, Chairperson?
Continue, Polnit.
Okay. There should be a special desk just to assist the older person, because the older persons can't stand in queues. They are supposed to be the first people that is supposed to be helped. If we listen to our public hearings, Chairperson, the old people were saying that the police are undermining the old people. They will rather help the young people, and the old people's rights are being abused by these younger people, but the police will never listen to the older persons. That is some of the complaints we got at the public hearings. And then some of the public hearings, we also heard that the police stations are very far for the old people to walk. The old people must walk very far to get to the police stations. And when they get to the police stations, they must stand in queues and they're not being assisted immediately. And then the one thing that is very, very close to my heart is the protection orders, where the police is not assisting the older person when they went for a protection order. And then the cases take long to go to the police, to court. And then the court, when they get there, the police is not assisting the old people to go to court. So that is one of my concerns. Chair, this thing is very personal for me. I have a mother of 75 years old. My brother is highly on drugs in Cape Town, and he's abusing my mother. He's stealing my mother's money. He's stealing my mother's furniture. He's stealing everything. And when she goes to the police station, the police ask her, "Did you see his ticket?" They are staying alone in that house, but the police want evidence before they can assist her. My mother is having a protection order till today. The police never came to pick him up, and she went and opened cases, Chairperson. The police stations, all these things that they have given us today must be implemented. No? It must be implemented at all the police stations, because the police must get special training to assist these old people, Chairperson. And we come to the Department of Health. It's right what the lady was saying. The Department of Health is lacking service providing. They are not giving service to our older people. Older people are standing in queues. Older people sit in the rain, in the sun. Older people must wait because they are very slow. There must be a special section where the old people are being assisted. There must be a special section where the older person's medicines must be delivered to the houses, especially in our rural areas where there is no clinic, where it's very far. And our older persons don't have the strength to do the things. I want to apologize, Chair. I'm here in Port Alfred, where the Premier is going to speak tomorrow, and the ANC is making a noise here with all the buckies. So I want to apologize for that. But that is my input, Chairperson. The older persons, the Department of Health is really lacking when it comes to services to our old people. They need to step up the game. The police, they need to go for special training because they are not assisting our old people. And this thing cannot go on like this because our older people are vulnerable and they can't help themselves. That is my input today, Chair. But sorry for the noise there. The bucket is going past. Thank you.
Chairperson?
Yes, I'm giving over to the next human honorable member, Bridget.
Thank you so much, Chairperson. And thank you to the presentations that have been given this morning that are very informative and are very, very welcome. Chairperson, just with starting with SAPS, but this is just a comment from me that when I heard the responses, especially from SAPS, about the actual sections of the amendment bill where, for example, it was mentioned, there was a question where the presenter said that, was asking, what do you mean by a responsible person or something like that? And I just wanted to find out, is it possible at all, I mean, with all things being equal, to have at the drafting stage, the departments that are being cited in these amendment bills being drafted to be consulted so that those things, they know that they are going to be sections of the amendment bill that will refer to them to say SAPS will do this, although the bill is being drafted or it comes from the Department of Social Development, because it then takes care of situations like now when SAPS is actually asking these very valid questions, and one would have thought that because the amendment bill is what actually mentions or refers some of these services to SAPS, that SAPS would have known about that ahead of time. And when they come here to the committee, they would just be responding to what the public hearings would have brought up for SAPS, for example. And I want to take this further to find out if it is possible that when the amendment bill is being taken to provinces and there are departments such as SAPS, such as health, and any other department that is being mentioned, if it's possible, if it's practical for those departments to be part of the teams that would go to public hearings, because they are in the amendment bill anyway, so they must expect that some questions will come up or some comments will come up from the public hearings that would need their response. That is just a comment. I don't know how possible that is, but I'm just asking if that is possible at all, Chairperson. And my question then is, it seems to me that the legislative framework of SAPS it covers most aspects, if not all, that were sort of mentioned during the public hearings. But I think the practice is lagging behind the actual the framework within which SAPS is working, because although this is not happening in the entire country, but the anecdotes and the examples that were mentioned in practically almost in all provinces made one think that these things are happening more often than not. For example, when there was an older person, a lady, that said that they have a problem when they go to SAPS to lay charges against their family members that are abusing them, assaulting them, or taking their money, or and so on and so forth. And then when they go to the police station to lay charges against these people, the police officers will just say to them, oh no, please go home and sort this out among yourself. I mean, your family, so you don't have to come here, type thing. Is that allowed? I mean, if I come and I'm saying I'm laying a charge, lay a charge for me. Do not sort of counsel me and tell me to go back home and so on and so forth. But I also saying that being mindful of the fact that this may not be happening in the entire Republic, but the mentioning of it was too often for one to wish to know if why is this happening? I mean, is it anywhere in SAPS's sort of directives and regulations and all the presentations that have been made this morning? And also, Chairperson, also on SAPS, I think the Department of Health mentioned this, the cases of older persons being attacked by communities and labeled as witches. Does SAPS have any advice as to what to do about this? Because I wrote on my notes to the Department of Health to say, perhaps the departments, including DSD, have to now, because this seems to me to be a newish thing, there has to be some awareness program that is being run even to communities for them to not do these things, because they are just adding on to the abuse that the older persons are experiencing as we go along. And I just wanted to also welcome and actually appreciate the mention by the presenter of SAPS, where he said that because of the sign language not being used as frequently as possible, the people that are being trained actually lose it. And this is understandable. And so there was a mention of technology. I don't know what technology it was referred to, but it just sounds like something that should be pursued, because these services, although they are not needed on an ongoing basis, but they become very crucial when an instance where a person needs them is happening. And then as far as health is concerned, I just wanted to say, taking it fully in consideration what the presentation said about the availability of medicines in hospitals and clinics and so on, to say that there was a lot of mention being made in the public hearings where people say that they even refuse to go to clinics because all they get is Panados, if at all. And so this is sad because they would have traveled as well on their own. Some, they say they travel and they walk in the sun or early in the morning, and they come back at 2 o'clock having not gotten anything because there was no medicine, and so on and so forth. And there were very heartwarming cases where they were saying that the caregivers that go in communities would actually take them there and go with them, but there's nothing they can do about the lack or non-availability of medicines when they get there. So I really believe that whilst we appreciate the statistics of the tracking and everything that was presented, but at local level, there might be a need for some work to be done, as it were. So also, Chairperson, the routes of the mobile clinics, I cannot agree more with the fact that they need to be reviewed, because there was a huge cry during public hearings that especially as the presenter was saying, especially in rural communities, that there is a huge need for mobile clinics, because people travel long distances. They hire cars. They go on horseback or whatever to get to these clinics, and because there are none that are close to where they live. So this is appreciated and would be appreciated and actually welcome for the mobile clinics routes to be reviewed and to be redirected as the need is arising. I would also like to know from health. I would appreciate if SAPS also can comment on this. I would like to know if the staffing, the actual lack of human resources in these centers, in clinics, in hospitals, and if that is what causes the good model and regulations and all these things that were presented, where people are addressed, respectfully, and they are, granted the dignity in the way that they are treated, where that doesn't happen, because there are cases where we've been to do visits because we've been called there, and there is no such thing, and one just thinks maybe this is the lack of human resources. People are too busy to be able to be attending to one person nicely and, with respect and honor and dignity that they deserve. So I would like to know if maybe this is the case or not, in fact. But I really would like to thank the South African Police Service and the Department of Health for the presentation. Thank you so much, Chairperson.
Honorable Mangani, thank you very much.
Thank you very much, Chair. Good morning, everyone, and also honorable members. My question for the police is this negotiation when my grandson, for example, have beaten me when I went to the police station, or when the police arrive at my place, they will negotiate on behalf of my grandson that this is your grandson, we have given him or her a notice, she or he won't do it again. I'm raising this because when we go through the public hearing, especially in my area, I took a taxi to a clinic, but on my way, I saw an old lady walking. Then I stopped the taxi, and then I asked the taxi to wait for me while I was asking where is the old lady going to. And the old lady said, I'm going to police station because at my community, the council of the tribal authority, they have said I must not go to the police because now I've gone to the police several times. Then I took the lady into the taxi. We went to police station. And then when I arrived, I said she must go first so that they mustn't see me. When she get inside, they said, no. We don't want you here. That's your grandson. Go and do in front of everyone. That is a humiliation. Then I intervene and I ask, whom did you report your case to? He said, this police that are full here. They know me. I reported several times. And then she have lost her tooth because she's been bitten time and again when the young man want the drugs. So I'm saying, if my recommendation to police, while I hear what they were saying, I'm saying, let's not try to be, there's somewhere when people are fighting where you can negotiate, but not an elderly person being abused every time and again, and the police always negotiate. I can go to the police, whoever doesn't believe, to say the old lady was here. These are the people who were treating her badly. So Mina, I wanted the police to ask for them to be recognized. They must also recognize our elderly as they preach in what they were saying here. I do agree they are on paper, but when you go there, there's something that is not matching with what is in the paper. So let's make sure that whatever we are doing for our own people. Next time, it will be your mother or my mother who will be treated like that, and then no one will talk. Let's assist them. They have complained in all provinces. There's nowhere where I have heard in the rural area, because I'm staying in the rural area. I've never had anyone who said, when we are at the police, we are given first preference. Sometimes the old lady is abused. She can't even talk in front of so many men and young women or young men in front of her. They should have that space that we have been told that there is a space where when you are abused as a woman, you can go there. So why not, it's not given to our elderly people? So that's my concern. I think it will be addressed properly when you do a review. Just make sure that this thing are happening. What we ever put on paper, we are practicing them, so that our people must have hope on police. When they see police, they must see hope. Not when they see police, they say, they are all the same. We must do difference so that people, they must see the difference, not us seeing the difference, them not seeing that difference. And then to the National Health Department, what I didn't get properly from them is this education. Elderly people need to be educated, and we need to be educated more about dementia. I must say I was very angry when I come from Canada, learning about dementia in Canada. When I came back home, I saw the sign on my mother. I thought, yeah, this is what they have said in Canada when we visited Canada. This is dementia. And then exactly when I went to the doctor said, no, she's very much old. I think it's dementia, not really dementia. I think it's dementia. So if we can be taught about it as the community, like before when we were having those people who were from the health department, when there is a disease, they come to the meeting and say, you must know that now this disease is broken out. We have to do 1, 2, 3, wash your hands, like when we were doing with COVID. Why we can't do with our own parents, sisters, when there's a problem? Why we can't tell them what to look or what to do? So I'm pleading, because I have heard that this dementia is for now. I don't think it's for now. If Honorable Member Bilangulu is on this platform, she can attest to it. Elderly people have been abused, heavily so. I remember in Limpopo, there is a village where one of the chiefs took them in different villages, those who were older women who were being abused by the community to say their wish, only to find that they've got dementia. This chief took them and put them in one place where they are staying, some of them even today. If we can't treat them properly, teach us, who will be able to always say, be careful, this is what is happening, when we are in the meeting, we call the tribal office. When they call the meeting, there will be somebody from the health department who will come and tell us what to do, what not to do. So I'm pleading that I know that what we are saying in ideal situation, those people who are privileged staying in towns, big towns or metros, they've got those people who are always teaching them. We at the rural, we don't have. Traveling, going to town to go and listen, sometimes we won't find them being in the hospital during that day or in the clinic. So I'm saying, I heard what the presenter was saying, but I'm still saying, where I'm staying or in the rural areas that are surrounding where I'm staying, they are still struggling with the clinic. They are still struggling with the medication. You go to the clinic maybe 2 months without getting the chronic medication that we are getting. They will tell you on the third one and say, we don't get this medication, let's change. But when you go far to other clinics in the township or in the metros, you get those tablets are there. You wonder why there is no system that will make sure that if you don't have the medication, you just the district or the province, don't you have whereby where the stock are put, so that when people looking for the stock, especially when it's still there, to get the medication. So people must not travel the way they are traveling. The others die on the queue while waiting for the medication that they won't get. So Mina, I'm saying, I heard what we are saying. This thing that we are saying, it means in an ideal situation. For now, it is bad because even the roads are not there. So it also compromises your mobile clinic that we no longer have it. I echoed the words of Honorable Masango that I so wish those mobile clinic, they can be available again, because in the rural, we've got just a building of so-called clinic, but there's no medication. But if those clinic, those mobile and the nurses can come again and be told that the doctor will come once or twice a month, even although we are getting sick when we are old like this, we are getting sick all the time, but it will be much better. And then I just hope that when you do your roundings, public hearing or finalization, please make sure that what you have in your bills, make sure that you contribute deal enough for elderly people, because really nowadays we reach 100 and something lifespan as most women I have realized they reach that 100 and something. My mother passed on when she was 112. So I think now I'm 72. I'm also an elderly. So let's make sure that we treat those who are before us nicely, so that we should say this really they are assisting us on making sure that we have a lifespan. Thank you very much, Chair. And I also appreciate hearing from the police and hearing from the health department. Thank you, Chair.
Thank you, Manganya. Can you give over to Honorable Kate Vilangulu?
Thank you very much, Chairperson, and good morning, everyone. Chair, I don't think I have much to say since it seems as if I'm the last speaker. But firstly, I would like to welcome the briefing by both the Department of SAPS and Department of Health. Chair, according to the responses that we received today, I think all the responses from the Department of Health and from SAPS, they were straightforward, and the challenge that maybe we might be having, since you hear even other honorable members talking about a lot of things, is that the implementation part of it's lacking. But according to the responses of the public hearings, their responses were clear and straight to the point. And I think they've addressed all the questions or the challenges that has been raised by the communities and also us as the portfolio committee. But with the ill treatment of both SAPS and health, I think that one needs to be dealt with. There are attitude in our police stations and also in health institutions. But those ones, I think they need time, and also we need to encourage our people when they are there to report all those cases, like the one Honorable Mangani was indicating, to say, I went to the police station with one of the old lady who was turned several times from the police station to dealt with. Because when we won't say that those things are not happening, they are happening. But according to the responses that they were giving, that we got from the public hearings, I think they are clear and they responded so well in all of them. Thank you very much, Chair.
Thank you very much, Kate. And then what I need to check, is there any other hand that I haven't managed to notice? If none, let's give over to the two departments to respond.
Thanks, Chair. Through you, I will allow Generals Ntumule and General Zulu and the rest of the team to come in and respond to specific matters raised against our presentation. General Ntumule, through you, Chair.
Thank you very much, Deputy Minister, and thank you to the Chairperson. Chairperson, before I allow my colleagues to also come in terms of the responses, I would like to emphasize that as the police, we are obligated by law to promote and protect and further support the rights of older persons. And this we do in collaboration with other relevant or like-minded departments. We also note the concerns and challenges raised by the public on the shortcomings or the gaps in policing, particularly in dealing with the issue affecting the older persons. As evident in our presentation, we are committed to closing those gaps and improving our service delivery model in dealing with, supporting, and protecting the elderly. In Zulu, we say, "Yindlela yethu sonke le," meaning that we are all going there. So in dealing with these matters, it is important that we exercise empathy. As Honorable Mangani said, "Yindlela yethu le, nathi ngilanga sizokhula." So therefore, we need to be considerate in how we deal with them. In relation to the special desks that need to be established or might be established in dealing with the elderly complaints, General Matonsi will respond together with General Pinar, and also they will touch on the issue of the proximity to the police station that also affects the elderly, including the issue of the queues as well. In talking to Honorable Marais, we note the issue that is more personal and where they are actually, as a family, are a complainant. I am going to request that we be favored with her details, and then we can be able to intervene accordingly. If she can exchange details with Brigadier Michelle on the platform, we will appreciate that. We will be able to deal with the matter as raised by her. In dealing with the issues of Honorable Masango, before I also hand over to the colleagues, we do know that as we are dealing with the actual amendment, the Van Rooyen is online, so she will also add on to the significance of that part. The other issue raised was the issue of legislation that covers everything. However, the issue was the gap between what is prescribed and what is practiced on the ground. General Matonzi will also talk to that. Maybe lastly, from my side, Chairperson, the issue of the elderly who are accused of witchcraft. I must add that this is a big societal discriminatory problem that requires an integrated, sustainable solution that enforces and ensures that we protect our elderly, particularly in the rural areas. So maybe we need to look at establishing a multi-dimensional working group that will focus on developing intervention mechanisms with different pillars. That includes the issue of awareness, the issue of protection, but also a reporting mechanism should such happen as well. DM, I would like to stop at this point and allow General Matonzi, General Van Rooyen, General Pinar to also come in on specific questions in that order. Thank you, DM, and thank you, Chairperson.
Thank you very much, Honorable Chair. Just to comment on a few questions as well. I think on the issue of the desk to assist the older person, as I indicated in the presentation, that we currently have established a GBV desk, which was specifically established to focus on sensitive cases. So I think what we will do as SAPS, we will explore the possibility of highlighting the issues of older persons. Sorry,
Comrade Chair, mute yourself.
Thank you very much for that. For saying that on the issue of the desk, I think we will look at it how we integrate the services, the support for the older persons, because currently we have the desk which we established specifically for GBV related matters. Maybe having a separate desk might be a challenge in terms of resources, etc. So we'll explore as to how we can incorporate older persons into that particular desk. Secondly, on the issue of the stations are very far. Yes, it is true that in some cases stations are very far, but as a department, we currently have numerous projects on new police stations. Obviously, it takes time to build this police station, but in some of the rural areas, we're unable to cover every single area. But in some areas, we have allocated mobile CSCs, which are assisting as far as this process is concerned. We're also working with the traditional leaders to see whether we can avail our resources to go and assist communities with administrative issues such as certifying the documents, etc., etc. So there is still that challenge, but there are numerous projects that are currently being undertaken by the department to build more police stations. On the issue of Chair, on the issue of the protection orders, yes, for a protection order, the first stop is normally the court. Once the court issue a protection order, and then the police are compelled by law to make sure that they execute as directed in the court order, in the protection order, including whatever conditions that the court would have taken. So I think if there is a specific case, we always request that be reported so that we can investigate. Because whilst we inspect stations from time to time, but we are not able to, as head office, we are not able to reach out each and every station in the country every year. So it might happen that certain stations, maybe they are lagging behind in terms of complying with the directives that we currently have. So we always request that. I think the other important thing, Chair, because some of the issues may be around the attitude, if there is attitude issues in some of the members and maybe not complying with the directives as indicated by Honorable Masango, I think that the frameworks are good, the directives are good, but the practice might be totally different. That is also important that for each and every station, we have the station commander, and the station commander is actually a manager for the station. And I think maybe as a department, we also need to do more, but it's to make sure that the communities know their station commander as a starting point. But secondly, is for any member of the public, if he's not happy, there is always someone we call a relief commander in the front office, which we call the CSC. If you are not happy with the service that you get, is to ask for the relief commander. If you also feel that the relief commander can't help you, you also have the right to say, I would like to speak to the station commander about my issue. So we encourage the community to do that, but we will also try to reinforce that during our awareness, and Ministerial Imbizo will raise also that issue about this particular issue of the older persons. As far as the old persons attacked for being witches, I think Jonathan Tumole has answered that. I'm not going to cover it. And then there was an issue on the sign language technology. Yes, Honorable Member, we are exploring some technology that can assist in terms of interpreting without necessarily needing a person to assist. So that's what we are looking at, and we're hoping we will pilot it in the next 7 stations or so to see how it works, and if it works, then we'll take it through the process. So that's a process that we're currently undertaking as a department. There was also an issue around the staffing, which I think also relates to health, but it also touched on us as well, whether they're enough and whether that might be affecting service. Yes, we don't have the ideal resources. It's true that we do need additional members here and there, but as we receive more members, we are able to cover those gaps. But again, any ill treatment of a client in the CSC cannot be an excuse, cannot use the shortage of members as an excuse. So it's totally a no-no to ill-treat the members of the community in spite of shortages that the station may have. Just to comment on the issue of the Honorable Makanya, I think raised this one strongly in terms of negotiating with a suspect by a police officer where he tried to resolve the matter. If a crime has been committed, it's also a no-no to negotiate. But obviously, depending on the circumstances, but I'm assuming if there is crime, in particular case, there was crime, if there was abuse and assault and so on, so there was a clear crime committed. So negotiation is definitely a no-no. And then as far as the private space, I indicated in my presentation that we have victim-friendly rooms, which were designed specifically to provide that private space for interview. But what we will do, maybe as a department, we will do some communique and directives to sort of re-emphasize the point of saying we accommodate the older persons, maybe irrespective of crime, but we accommodate them in a private space, victim-friendly room for interview, so that they can be treated with dignity. Yeah, I think those are the questions that I can comment on at this stage. Thank you very much, Honorable Chair.
Thank you, Honorable Chair. DM, before you take over, I would like to add on the last question by Honorable Manganye that talks to what Matonzi was talking about now, the issue of negotiation. I want to also highlight to the meeting that in the criminal justice system, we have the alternative dispute mechanism or resolution, which is the only legal instrument where we can negotiate the issue of crime being committed and how it is resolved. So that is the only process where the police can get involved together with the NPA and Justice Department through the courts to assist the disputing parties in dealing with a criminal matter. Such incidents where police negotiate issues of crime between disputing parties, that we report those to the National Commissioner, whereupon these matters will be dealt in accordance with our disciplinary regulations. Thank you very much, Chair, and thank you, DM.
General Zulu, do you have any comment to make? And General Van Rooyen?
Thank you, Deputy Minister and the Chairperson. I think I am covered with most of the responses that are being given. Just to add on the side of training, we are continuing providing members and then also doing our localized training to ensure that our members are enhancing the service delivery when they're in contact with the victims. As recently, we even reviewed the Victim Empowerment Learning Program to make sure that it deals with, especially mostly with the elderly people as well as the people with the suffering from presentation that was made by Department of Health, which I think we can learn a lot from each other. There are best practices that they've highlighted in their presentation. As the head of education, training and development, the SAPS, I would love to engage with them, especially how do they improve their systems in terms of dealing with elderly people. Thank you so much, Deputy Minister.
Major General Van Rooyen.
Good morning, Honourable Chair and Honourable Members, Deputy Minister and all other colleagues on the platform. Just a few remarks from my side, if I may just switch off my camera. On Honourable Masango's comment pertaining to the consultation of legislative amendments, yes, we are part of, as government, working closely together on proposed amendments to legislation. But as you will also appreciate, Honourable Member, sometimes other parties also engage and provide comments that leave it to the department to decide what to incorporate into legislation. But we do have a good working relationship with our sister departments on this matter. Therefore, our comments are really just to strengthen aspects pertaining to the legislation. On the comment from Honourable Marais, insofar as economic abuse is concerned, in terms of the existing legislation, economic abuse already includes the deprivation of financial resources to which an older person is entitled or which an older person requires out of necessity. So the definition of economic abuse already covers financial deprivation or the taking of the money. Honourable Chair, just another comment that I want to make, and I think that highlights the difficulty on this topic. Both Honourable Marais and Honourable Manganye mentioned the drug abuse. And I think we cannot underestimate the scourge of drugs in our society and the impact that it has specifically on older person abuse. In this regard, I think we also need to highlight the need to raise awareness amongst our communities and especially the youth on the dangers of drugs to prevent drug abuse, and also as government to ensure that there's effective treatment of drug abuse to minimize the risk of older persons abuse. Thank you, Honourable Chair.
No, thanks, Chair, and thanks, Generals, for your input on the comments that were made by members. We take note of the concerns that you have raised based on our response to what members of the public said about SAPS. we will be the last to appear before you and say that the attitude of the police is always perfect. This is an institution that is part of institutions that must be transformed in the country. The South African police as a service to the country historically, it was meant to behave in a particular manner. And in 1994, when the dawn of democracy came, we then resolved to have a service, not a police force. And therefore, it meant that the training that police officers had from the previous administration had to conform with the norms of a democratic society. And that was not going to be a mechanical change, that now we have changed the name of the service, therefore automatically their attitude will change. Any institution that you create, that institution develops mechanisms to sustain itself beyond the day it has been created. So to change the attitude of an institution is not an easy process. It needs determination from both the political leadership and the administrative leadership. In our case, the leadership of the ministry and the management, led by General Masemola and Minister Kele from the ministry, to ensure that we have a service that those who came before us intended SAPS to be. And it's going to be a long journey. And given what you have experienced yourselves as you went about interacting with our people and what they told you about what they experienced at the hands of the police and what you yourself have experienced, and you have outlined this morning that you talk of experiences that you have had with the police, the issue of an attitude. I am not saying that all members of the South African Police Service are not good, and I don't think that is what you are saying. You are raising an issue about instances where police are not responding in a manner that is appropriate. We are aware of that and we are working on it. It will be a continuous program until every member of the South African Police understand that they are here to serve our people. Hence, we call them the South African Police Service. The reason why, for instance, we have got a directorate called IPID, which is the police of the police, is precisely to assist our police officers to conduct themselves in a professional manner where they will not need to be policed as police officers. But because of what I've spoken about, our history, those who came before us saw it necessary that we must create an institution called IPID that will be the police of the police, to ensure that any wrongdoing by our police personnel, there must be an organ that can take charge and investigate whatever wrongdoing that police have committed, including where wrong is done. Police can be arrested by this organ to try and correct that. This was an acknowledgement by ourselves that we will need an oversight body to oversight this. It's a struggle that we are waging. It's a struggle that we are succeeding because we have a greater number of police officers in the service that are serving our people with pride. And we do have community members who call us and appreciate the good work that police are doing. Just some few weeks back, we had awards, and one of the people that we were awarding is work by a unit in a police station in Tzaneen, in Limpopo, where a member of the public communicated with the minister to appreciate the service that the FSC unit in that police station did a good work where there was a case of a woman abuse. And in most cases, we say GBV cases are not appropriately handled. But here you have a victim who felt that these police officers that helped her, they are completely different. They deserve to be recognized. And they were accordingly recognized for the excellent work that they have done. This award was not given to the unit by ourselves as a ministry, but it is a recommendation that came from a member of a public, from their personal experience at the hand of the South African police. This is but one good story of good police officers within the service. We have quite a number of them. And most of them we came with today to appear before you. And the presentation that they have presented before you, which you yourself have said is a good presentation, and you so wish all of SALPS could be working in the manner in which it has presented here today. This is an example of men and women that we have in the South African police who understand their responsibility being to serve our people to the best of their ability. However, we do have elements within us who behave in a manner that is not appropriate, but they are not in the majority. The majority of our officers are really doing a great job. General Zulu is correct. In our training, we are continuously ensuring that the recruit that we are training, as they pass out to go and join the greater force, their perception and their attitude towards serving our people is completely different from those that went before them. So we continuously improve and we continuously learn from the best practices, like she has already picked up that there is one or two things from the Department of Health which we can learn from, which will make us better people. And definitely she will be reaching out and will appreciate Director General if your management can assist us and make us access the issues that she has observed, and we work together to try and better ourselves in order to serve our people to the best of our ability. Appearing before you, Chairperson, and your committee members is a learning experience to myself, to the team that I have come with here. The issues that you raise, the concerns that you raise with us, they don't fall on deaf ears. We hear you, we'll take it back with us and see how far we can go in improving ourselves. Some of the issues that you have raised, we have raised them ourselves and we are working on them to improve the attitude of our police officers, because that has a greater bearing on the collaboration between communities and police officers. If our people don't get better treatment from police officers, how do we expect them to collaborate with police in helping police to do their work? We will not succeed in policing in South Africa without collaboration with communities. And there is no community that can collaborate with a stubborn and an arrogant police officer. It is in our interest to change our attitude. It's in our interest to embrace our communities, because they will make our work much easier. In any case, there is no single success that we have recorded in the South African Police Service without the participation of our communities. Every single success that we talk about as police is a success that came about as a result of a community member, as a result of a community providing information to us to execute, and we become successful. It is not out of our own wisdom. But thank you very much, Chairperson and members of the committee, for this interaction. It has been very educative and very informative. We have learned we are better than before we came to appear before you. Thanks very much. And thanks to the team for the responses that you have given to members. Thank you very much.
Thank you very much, Honorable Deputy Minister Matali. Now, because we still have to give an opportunity for Health Department to answer, and we still have another. You can be recused in the meeting, subs. You are done now. Thanks ever so much. We know for a fact that there's a lot that needs to be done. We understand exactly that there are people who knows where, when, and why are they in the police. They do their work diligently, but there are those that are still undermining the communities. But we hope for a better services from all of them. Transformation is the best. We cannot stay where we were before. Tomorrow is not the same with the yesterday. And thank you ever so much, Minister, and your team. You are excused. Can we give over to Health quickly to respond or comment to other concerns at the event? Because the long and short of it, the cry in all the provinces, it was police that are really not treating older person. Sometimes they think that they are just having that dementia and all the stuff. We very happy, Deputy Minister, if you can preach that evangelist so that they can change even in other police stations, especially the ones that are in rural areas and are far from the towns. Thank you ever so much. You are excused.
Thank you, Chair. Thanks, members.
Can we give over to the Health Department?
Thank you, Honorable Chair. I'm going to respond to the input that we received from Honorable Marais, Honorable Masango, and then Honorable Manganye. And those broadly dealt with the waiting of older people in queues, standing in queues without shelter, and also the shortage of medication. Chair, as we said in the presentation, there are definitely areas of poor performance. It links with what Honorable Bilankulu has said, that yes, we may have policies and SOPs that we devolve from national into the provinces, but the issues with implementation, I do want to say, Chair, again, it's not pervasive, because we have to acknowledge that there are many health facilities where things are being done properly. As the Honorable Deputy Minister has said, health also receives many compliments, kudos, and thank yous from community health members who received good treatment at all our health facilities, be they clinics or be they hospitals. But we'll have to seek out, and we have to encourage our communities to point out the areas where our performance is substandard so that we can correct whatever weaknesses are there. Honorable Chair, I also need to speak directly to the point made by Honorable Masango. She asked the direct question, the Honorable Member asked the direct question, whether a lack of staff contribute to poor experiences of care from our patients, including older persons. Again, not everywhere. The DG of Health, Dr. Buthelezi, just last week visited a health facility where complaints were received. And indeed, he found that the complaints were valid. He found that the conditions that were complained about were there, the negative conditions, but he also found that that primary health care facility was grossly overstaffed. So where there is understaffing, we always try to correct it with redistribution, because there are areas of overstaffing as well. And where you find that there's enough staff, you then need to understand and act on the issue of willful neglect in terms of doing what is expected to be done to make sure we provide South Africans with the required quality. Chair, please allow me to stop there. I think I've spoken to that issue, that we'll have to seek out the areas where of poor performance. We'll have to make sure we do have coverage and proper coverage of services in our remote areas by working with the provinces. So yes, we acknowledge the staff in the field who's doing excellent work, but we also, as National Health, working together with the provinces and other partners, correct where there's wrong. I just want to say we welcome the input from General Zulu, wanting to look at what SAPS could learn from, I think, our continuous quality improvement framework. But similarly, I've listened to the presentation, and from what I've heard, I think SAPS is ahead of us when it comes to sign language, the use of sign language and interpretation in the police stations. I think that's also an area that we could learn what SAPS is doing and how they are doing it in the police stations where that is already happening. Thank you, Chairperson.
Thank you very much, Department of Health. We are really appreciating your presentation and also responses. But if you can just improve in this one of letting the older person to have long queues and not prioritize them in these hospitals and clinics. They are really frustrated about that. We understand that you improve as the time goes on. How we wish that you can fast track that improvement so that at least they be prioritizing queues. It's bad for them whilst they are not well, but you don't really take into consideration on that. Thanks ever so much. You are also excused, and we wish to thank you with your team. Then we will be left with Higher Education Department so that they can present, and then we'll deliberate on. Thanks ever so much once more. You are
Thank you very much, Chair, and all the best to you and the committee in this work.
You too, all of you. Thank you. Over to you, Department of Higher Education. And can I request to give over to Honorable Kate Vilankulu to hold the fort for me? I understand now I might have some challenges in this thing of the network. Thank you.
Thank you very much, Honorable Chairperson. And good morning to the Honorable Chair and honorable members, the honorable ministers and deputy ministers present in the meeting, as well as my colleagues from the department and from all other departments and staff and management of Parliament. My name is Thembisa Fuchane. I am the Deputy Director General responsible for community education and training. Honorable Chair, honorable members, let me first start by tendering an apology for our Minister, Professor Nzimande, our Deputy Minister, Buti Manamela, as well as our Director General. We are currently in a physical meeting which is chaired by the Deputy President of the HRDC, and they send the apology that they cannot be part of the meeting. They've delegated myself, as well as the Deputy Director General responsible for corporate services. We have Ms. Rulani Ngwenya present. I also have Advocate Monica van der Walt present in the meeting, as well as our PLO, which is Mr. David Muhlame. There is a presentation that was shared. I'm going to flight it. And through you, Honorable Chair, I can now switch off my video. It was just to prove that I am not a robot. And then I will then start with the presentation. A presentation was shared with the honorable members of the committee. I want to indicate that the presentation that I'm going to be sharing is the same as the presentation that was shared. However, it is an abridged version of that presentation, but the content and the quality of the presentations are the same. Through you, Honorable Chair, if I can get an indication of whether the presentation is showing on your slides, then I will proceed.
Yes, it is. You can proceed.
Thank you very much. We are very much honored as the Department of Higher Education and Training, particularly the Community Education and Training branch, to be invited by the Portfolio Committee to present at this meeting, because the area of interest that has been indicated to us is an area of interest for us as well, particularly for community education and training. This is just an indication of what the presentation will cover. I think it's important for me to just give a brief background on our community education and training colleges. Here is an indication of the legislation and policy framework that guides the work that we do in community education and training. And the background here becomes even more important because the history of community education and training is extremely important. Previously, community education and training were known as night schools, as those who will remember, or they were known as ABET centers. Honorable Chair, honorable members may recall that in 2009, the education department was one in the country, and it was split in 2009 into basic education and higher education. And community education and training then remained with the Department of Higher Education. We are also guided by the white paper on post-school education and training, and this is the white paper that called for the establishment of community education and training. This is a relatively new sector in terms of institutional type. If you look at post-school education and training in the Department of Higher Education and Training, they were only established in 2015 through the Continuing Education and Training Act, and there are 9 community education and training centers, 1 per province. Therefore, the previous former public adult learning centers were incorporated as community learning centers. Also important to note then was a migration of the function from provincial education departments, and community education and training is no longer a provincial competence, but a national competence with effect from 2015 due to the migration. The examination side of community education and training only migrated on the 1st of April in 2022. The mandate of community education and training is that they cater for everyone who's out of school, caters for adults who have never even set foot in a school, those who did go to school or drop out and wish to continue, those who want to have a second chance to study in order to improve their education levels and also to improve their livelihoods, and those who want to use community education and training as a launch pad to access TVET colleges and to access universities. So anyone and everyone who wants either formal education, who want a skill, or who want to be taught to read and write, our community educations are meant for those. What is the problem that we want to solve in community education and training? Firstly, it's the issue of the people, those that are not in education, not in employment, or not in training, what is commonly referred to as NEETs. And we have stats that has been done by Stats SA that shows us that there are approximately 17 million between the ages of 15 to 60. Of course, the number is more if you look at those that are above the age of 60, that are categorized as not having been in education, in training, or in employment. We are also concerned about the high illiteracy rate in the country. In this country, we have nearly 4 million adults who are functionally illiterate. Some of those have never even had an opportunity to have a literacy program. Honorable Chair and honorable members, let me remind the House that there used to be a Karikuta program run by the Department of Basic Education of basic literacy and numeracy, and that project had ended, and therefore the mandate remains with Department of Higher Education and Training, particularly community colleges. Of course, we're all aware of the high unemployment rate in the country, which the latest stats indicates to us that it's sitting at 32%. So these are just some of the challenges that we aim to eliminate through community colleges. Where are we as community colleges? We are all over the country. We are embedded in the communities. Earlier, I indicated there are 9 community colleges in the country, 1 per province, and they are named by the provincial names. However, it is important to note that each community college has multiple community learning centers. In total, there are 200 of them. And further to that, the community learning centers have 1,591 satellite centers. So in essence, Honorable Chair, honorable members, you are looking at contact sites that are sitting at 1,791 throughout the country. I must indicate those, though, that 96% of these are operating from schools. Some of them are platooning, and some of them are using schools which have been abandoned by the Department of Basic Education. It's only now that we have 1 billion rand and we're starting to build infrastructure that is fit for purpose and that is dedicated to community education and training. Generally, the programs that are offered in community colleges are mainly academic programs, and to a lesser extent, as you will see that the gray area, which shows 49%, and the orange area, which shows 38%, are mainly your formal programs or your academic programs. And then a small percentage, of course, including also the 7% indicated as AET levels 1 to 3, those would be your literacy programs. Then a small percentage will be your occupational skills and non-formal programs. And we want to increase those programs so that people can attain skills that can assist them to have sustainable livelihoods. These are the programs that I've alluded to earlier, your basic literacy programs, your general education and training certificate. We also do offer a senior certificate, an amended senior certificate. We offer this in collaboration with the Department of Basic Education. I must also indicate we also offer a second chance matric program, which is the National Senior Certificate. Even students who wrote as early as last year who want to improve on their subjects can come to our community colleges for the improvement. I've alluded to occupational skills program. We assisted a great deal by sector education and training authorities, Department of Science and Innovation, the QCTO, particularly with accreditation of the programs, and the Catholic Institute of Education. We work a lot with faith-based organizations, NGOs, and CBOs. There are also non-formal programs, which are, I must say, could also be suitable and useful for older persons. And we are assisted in non-formal programs by the German NGO, which is DVV International. These are some of the examples in terms of occupational skills and non-formal programs that we offer. In the non-formal programs, which are very popular, your sewing, handcraft knitting, crocheting, pottery, gardening, poultry, beadwork, leathercraft, baking, and many others that are not here are being offered. And you'll see on the left, you'll see examples of the occupational skills program. We've also introduced new ones, for an example, cell phone repairs, which are very popular, particularly with younger persons. Further examples of non-formal programs and occupational skills programs that are offered in our community colleges. We have accredited programs, non-accredited programs, and non-formal programs. So the scope is wide depending on the needs of the community. Must emphasize that program offering is dependent on the community needs, and hence A community college, and particularly a community learning center, will offer the programs based on those community needs. I will not repeat this slide, as I've already spoken to the program qualification mix, which is the programs that we are offering. I must indicate that, like many, if not all government departments, we are affected by limited funding that National Treasury subjected most departments to due to the fiscal constraints. On the left-hand side, it shows the community colleges. As I've indicated, it's 9, and they're called as per the province. And the third column indicates to you how much we have in terms of operational expenses. We have 221,144,000 to run operations. However, an indication is that we need to have 885,361,978 rands to be able to at least efficiently run operations within our community colleges. What this tells us that the sector has a funding gap of 76%. Unfortunately, we do not have the money, and as we all know, Treasury has limited funding to provide to departments, particularly new funding. As I'm coming towards the end of my presentation, I just want to indicate the comments from the department in terms of the Older Persons Amendment Bill, in that we welcome the establishment of an interdepartmental structure to coordinate and integrate care for older persons. The department supports the principle that all services to older persons should respect, protect, and promote the rights of older persons, and that the department supports the inclusion of Clause 7A that older persons may not be denied the right to mentor and pass on knowledge and experience to a younger person. Must indicate, Chairperson and honorable members, that this is critical to us because some of our programs, particularly the non-formal one, we encourage our community colleges to use older persons for those programs. Most popular would be the bead work that is being done, because older persons are very good in that. They understand the history, the meaning behind the beads. Arts and crafts is very big in relation to that. The department supports Clause 8 that only a juristic person or trust may be registered to provide community-based care and support services to older persons. And DSD could make use of community colleges to support in this regard, because community colleges are legislated. All our centers are gazetted. The gazette is on our landing page of the Department of Higher Education and Training website, which is www.dhet.gov.za. It gives a list of all our colleges, all our community learning centers, and satellite centers. The department supports Clause 9 on prescribed training for persons providing home-based and frail care and a prescribed code of conduct for caregivers. Definitely, DSD could make use of our community colleges to support in this regard. The department further supports Clause 9 on the training of volunteer caregivers and keeping a register of caregivers providing home-based care and frail care. Again, our community colleges could provide support in this regard. And we support Clause 10 on the monitoring and evaluation of community-based care and services. The correspondence that we received from Parliament was that community education and training is no longer provided at residential care facilities for older persons, and that older persons must be taught writing skills. A request was made that community education and training should be reintroduced at residential care facilities, and there should be training programs where older persons can be trained on how to use technology, ATM, smartphones, and computers. And they should be educated on financial management. Honorable Chair and honorable members, we welcome these requests that have been put forward, and the department is responding by saying that we recommend that we enter into a partnership with the Department of Social Development in relation to the previous slide that talks to the correspondence that we've received in support of older persons. We could look at a protocol and an implementation plan that will enable us to have this collaboration. And that DHET, we also request from DSD that DHET be provided with these residential areas that require the identified programs, because should we have these, we are able to align them to the nearest community learning center or satellite learning center. As I've indicated, throughout the country, we have 1,791. We're also looking at lecturer provision in older persons' residence facilities, subject to a mapping that I've indicated to earlier. We need to work out the costing implication, because I have indicated a slide where I've showed that we have a 76% funding gap. Having said that, I do not believe that will stop us in working together. One of the things that I'm proposing that we do is that the Department of Social Development and the DHET City branch, we can collaborate on a funding proposal that will put together to the National Skills Fund to fund specific programs. We can also go to some of the SETAs, by the way. This is where these interventions cannot be covered by a community college and cannot be covered by the Department of Social Development. We currently have a very good relationship with the National Skills Fund and most of the SETAs. So this is something that is feasible. Having said this, I need to highlight that I'm saying that this is a parallel process. We will currently work with what we have so that we share the limited resources that we have. However, if we want to go to scale and make a bigger impact, we then need to work together and within government and the private sector seek additional funding. Infrastructure access, maintenance and development, we can access some of the social development facilities for program delivery as has been indicated. We can request our lecturers to do outreach programs. This should ideally be a center aligned or linked or mapped to the nearest older person's residential dwelling. And the reason for this is to minimize on costs and minimize on resources, because we don't have cars in our centers. And lastly, Honorable Chair and Honorable Members, we can take our general education and training students who are doing ancillary healthcare, early childhood development, arts and culture, agricultural studies, and others. They can go and do practical community tasks in the older persons' residential areas. Honorable Chair and Honorable Members, I thank you, and thank you for this opportunity to engage with yourselves. That is the end of my presentation.
Thank you very much. Thank you very much, Ms. Fuchan. Honorable members, that was the briefing by the Department of Education in response to the public hearing inputs on the Older Persons Amendment Bill. Can we engage the briefing? I see the hand of Honorable Aris, then Honorable Masango. Honorable Aris.
Yes, good morning, Chairperson, and please allow me to say humble apologies that I have logged in late. I was on a flight. My question to the Department of Education is, seeing that they have made the reference of training, and I most obviously want to believe that it is this caregiver training, and I did see that they have also touched on the things that is worrying us in terms of training for people that are doing residential care. My question then is, I want to know if this training that they will be given to these people, what is the accreditation level? And if those that will get the training, if they think of in the future continue with studies in health, will that, whether it's a certificate or whatever they will get, whether they can, what credits will that training be? And then also the other thing that I would like to know is, when the department think of training these people, because most obviously these caregivers are, or caretakers or care workers, whatever we call them, they are the ones that on a daily basis are looking after our people. So I want to find out, because it can't be a full-time training, how will they conduct this training? Will it be part-time after hours training? Will it be a virtual training? So that's the type of things that I would like to know. Thank you, Chairperson.
Thank you very much, Honorable Aris. And Honorable Masango.
Thank you, Acting Chair, and thank you so much to the Department of Higher Education for the presentation. It was quite informative. I just wanted to latch on the part of the presentation that was talking about, extending training to the residential facilities, especially on technology, and to say that it is it's just such an amazing initiative if it's a new thing, because if one looks at the work that we are doing in the portfolio committee and also the briefings that we get, that making one think that the services, especially the grants that are being provided by the department through the agency, the South African Social Security Agency, are becoming more and more technological in the way that they are being accessed, because they are now online. You can apply online and so on and so forth. And the older persons would need to be sort of brought up to speed in terms of training on how to use technology to access these services. And also that would, I believe, I'm not sure, I'm just imagining that it would also reduce the queues at SASSA offices, because the older persons especially, and everyone else who's a beneficiary of the grants, of government grants, that they would spend in queues, they would spend in their gadgets, making inquiries and filling in their forms on their phones and any other gadget that they may have access to. So this for me is really a valuable sort of service that is being made available, if it's already available, or if future modules will include that, because even the services of government can be, these people that are doing the training can actually give the training as to how one can access these services, how one can access grants, how does one appeal, and so on and so forth. I am just saying, the point I am making, Acting Chair, is that this is such a welcome sort of presentation, as it were. But also, Chairperson, I wanted to find out when this part of the DHE is doing or is developing these programs, do they just develop them themselves, or in this case, DSD would say, listen, we are now coming up with this new technology where people will access their grants in whatever. I know that these are the things that can be done through awareness creation programs, but I also think when they mentioned teaching or training the older persons on technology, the first thing that jumped into my mind was the technology that is now being the platform through which the services of government are being provided. And I thought that if these are being, if our older persons are being trained on this, this would really help. It has far-reaching positive consequences or implications for the older persons themselves, because during the public hearings, we heard about people going to SASSA offices now and again and not getting help, and then the offices offline, and so on and so forth. And if they can access these services technologically, that would actually be a better thing for them. But other than that, Chairperson, I just believe that this presentation was so informative. I don't know if it's because of me that has not ventured into reading about the services that are being offered by the Department of Higher Education in as far as community colleges are concerned. So that is me appreciating and thanking the department so much for the presentation. Thank you so much, Chair.
Thank you so much. Thank you so much, Honorable Masango. Honorable Murray.
Thank you, Chairperson. Thank you for this presentation. Good, Chairperson. I just want to know, like Member Aris was asking, do you have a program where you say train the trainer? Because say I go for training to work with older persons, how to dress, how to wash, doing all these things for a facility. And when I get to the facility, I can train other people to do the same things. Do you have a facility like that? And then I also would like to know, a lot of times parents don't have time to go and study because they had all these children at once and all those things. Now they come to retirement age, they're 60 years old, and now they don't have anything to do. So do you have a training or do you have colleges where these older persons can go and study? They want to go and study something, but they don't have a matric certificate. But because they have time on their hands, there's nothing wrong with them. They are active, they are doing everything for themselves. There's nothing that's keeping them in the house anymore. Do you have such training for these people? Because older people like to go and investigate. You said you have training for beads making and all those things. But say a person would like to go and study to be a nurse or want to be a social worker, or whatever the case may be, something that is in the line where you need to have a matric certificate. Do you have programs like that is catering for people 60 years and older? Thank you, Chairperson.
Thank you very much, Honorable Polnit. Honorable Manganyi, Tati.
Good day, Tati, and honorable members. Bachabiseke Nkwamo. I'm so excited about the program that the higher learning the education is have presented to us. I think when we were doing roundups of public hearing, we heard elderly people saying we have age, but not our mind. We can still, it's just we have been cut by the age that you teach up to this or you work up to this, but our mind are still fully functioning. I think this issue will address what the elderly person was crying about, that you don't use us. We've got many things to tell. We can teach our grands why we have grown up to this age. So I think this it needs, as they have said, I so wish the incoming what do you call it? The seventh parliament can also be briefed, or when you do the report, just add this on that report, that really the social development, according to me, we need also to can buy in on what we had today, because this, it will make sure that our elderly people, where they are doing something, and they are also learning to teach others about the skills or the knowledge that they have. Going to the community center, learning, working together as elderly, it won't make somebody to sit at home and think something that won't help, to say I'm alone here. It will also take them out of the loneliness to go and work together with other women. I so wish, I'm very much happy. I don't have words. Other members have already said something, but Mina, I'm just, I just raised my hand to say thank you. You know, la magama esiXhosa ayandihlupha, andikwazi saba nokukhuluma ngoba ngizabhuda igama lomntu. So I'm so happy about this. I hope you could make sure that these programs, it been advertised where elderly are, even the individual old women who are staying far from each other can buy in on this. Thank you very much. Thank you, Chair.
Thank you very much. Thank you very much, Majane. It's so pleasing if you hear somebody of your age saying that or mentioning that excitement that you had after the presentation. What the Department of Higher Education should know is that Majane is that in that age. So whatever she's saying, it means she's going also to assist other old women out there with the experience that she had from Parliament and also from the society. So wherever you are, don't forget that in the Northwest, you're going to meet Majane, and she will be, by then it will say she was a parliamentarian. She know how laws are being made. So she's equipped, and I'm happy if she is happy. I'm so happy for you, Sisi. And thank you very much, honorable members, for all the contributions and all the questions raised and the comments. Now I will give the opportunity to higher education. Ms. Fuchani, I don't know if there's somebody else who's going to help you in responding, or it will be yourself, but over to you. Thank you.
Thank you very much, Honorable Chairperson. Let me first appreciate the comments from all the honorable members and the questions, and they assist us in further building and enhancing the work that we do in community colleges. It's been a pleasure to engage with the honorable members, and I'm personally looking forward to one day maybe meeting Honorable Manganye, because there's a lot that one can learn actually from all the members that we can take back into our community colleges. Then answering briefly, let me start with Honorable Aris, who asked about the accreditation levels and whether those who do these programs will be able to continue with the studies and what the credits will be. The credits will depend on the program and the status of the program. In my presentation, I indicated the various categories where I've said we run programs for those who have never even set foot in a school. All our formal programs, of course, are accredited. So when we talk about non-formal or non-accredited programs, it will be on your occupational skills and your non-formal programs. But your formal academic programs are accredited programs. And of course, our institutions are government institutions that are accredited. The best mechanism it would be to say which older person's residential area wants which program. And then we link it or align it to the nearest community college and community learning center. And of course, look then at the accreditation levels. Most of our programs, accreditation levels are at entry. And the reason for that is because the higher levels of accreditation you find in your TVET colleges, you find in your universities. We are the institutional type that must provide education and training for those who don't have access to any other institutional type, so that they can then be assisted. If articulation is required, then they can be assisted to articulate into higher education, into other institutional types. Honorable Aris also asked about the caregivers who are looking daily after the people and how will training be conducted. Again, the modus operandi of the training will have to be negotiated between ourselves, the college, and the center closest. Earlier, I indicated that we can even do an outreach program. If the older persons are located in one premises or one area, lecturers can go to that place and offer the training, because in many instances, you may not want your older persons to be going up and down, but our lecturers can do that. I'll give you an example. We have a partnership with correctional services. Because they're inmates, they're a captured audience, they have to stay inside, but they want to be educated. Some don't have even the lower levels of education. We negotiate with correctional services that our lecturers go to correctional services to then provide teaching and learning and training. So a similar arrangement can be made. Older persons who are able to go to a center, the nearest center to them, are also most welcome. The environment is conducive for young and old, so we are able to accommodate them. Training in terms of online banking, working with social development, we can customize any training, because the nature of community colleges and the services that they provide, we can negotiate training, what training is required. And I like this of new programs that are coming in for SASSA, training them on online banking, and making sure also if you train them on online banking, they're also aware of the security risks, so that, you know, they are not, because older persons by nature, the majority are vulnerable. So we need to make sure that they are safe at all times. They can be trained on WhatsApp. Wouldn't it be lovely when our older persons can WhatsApp their grandchildren and do video calls and see them at times when they cannot see them physically? So the issue of training and accreditation and programs and where training takes place, that can be customized. Based on need. The issue of SASSA services online was raised by Honorable Masango. Again, this is a matter in terms of technology advancements, and Honorable Masango is correct. It can reduce the queues. Some of our older persons, they leave their homes at 4 a.m. They sleep in these places. There's an element of the reducing or compromising the dignity of our older persons when they do that. So if you can assist in this regard, it will increase their safety, and also it's a much more dignified way for them to access their services. Therefore, Honorable Masango, program needs can be discussed and developed in partnership with the Department of Social Development. Honorable Marais asked the question of whether there can be a program for train the trainer for older persons. Again, in the same vein, these are the programs that we can negotiate with. We can look at our current catalog of program offerings and fit in terms of what is available, because we do have programs that are already available. But where you feel that there is a gap, we can do customized training that will suit the needs of social development. I think it was also Honorable Marais who asked the question that they don't have matric, and what if they wanted to study further? We don't have programs for one to study to be a nurse, but we can bring up in a lesser time. Remember, a young person, if they go through schooling, they have to go through 12 years. But with our programs, they don't. 3 grades can be done in 1 year, for an example. And we have a matric for adults that has got fewer learning areas or fewer subjects, and therefore they can attain a matric much earlier than a young person going through a 12-year period in terms of going to a school. I mentioned earlier that community colleges are best positioned to be a launchpad, and we have many success stories where community colleges were used to be launch pads. People who have dropped out of school, never had matric, they then came back, because many schools, although this is not in policy, but many schools reject older persons who want to come and study further. But we welcome them in our community colleges, and once they get their matric, they can use that as a launch pad to either go to a university, and they are recognized. Our senior certificate, our mandate senior certificate is recognized in TVET colleges and universities. On a different day, when we have more time, We'll share success stories of how people have dropped out of school for 10 years or more, came to a community college, obtained a matric, obtained a TVET qualification, some obtained a university qualification, and now they are teaching like any other teacher that you see or other doing other jobs, but have similar qualifications like a person who went through the mainstream schooling. Thanks very much, Honorable Manganye, for the motivation and the kind words that have been indicated. And certainly, we will make sure that our advocacy reaches older persons as well in terms of the program offerings. In closing, Honorable Chair, I just want to indicate as well, you also get older persons who want to study or want to get a matric, not necessarily, because remember there's academic or formal programs, skills programs, non-formal programs, but you get some that want to get a matric because they want to get a matric, because there's dignity in having education and it's a wish. It's probably on their bucket list for some of them. But what we do is to say, whilst they're getting that matric, we can also assist them at the same time, parallel to getting the matric, to get a skill or to get a non-formal program. On accreditation, it's not every program that needs to be accredited. For an example, if we teach elder persons on WhatsApp or how to use WhatsApp and how to do video calls or how to do online banking, certainly we can look and find and talk to QCTO on accreditation of that program. But accreditation is not the end and be it all. Some want to gain the knowledge so that it can help them with their daily lives when they get the training. Hence, we refer to non-formal programs. We have an exciting program which we've done with QCTO and Higher Health and the Health and Welfare SETA, which is on civic education. That one is accredited at NQF level 5. It covers GBV, alcohol and drug abuse. It covers almost anything and everything that is required by our opportunities. And it's a new way and an exciting way of learning that they could also have access to. As I close, I must indicate then, Honorable Chair and Honorable Members, and remind the House, Sipho Stix Mabuse was famous, he was popular, he was well known when he decided at the age of 60 that he wanted to get a matric, because he dropped out of high school in 1969 to pursue his music career. And in pursuit of his music career, he became very successful. But he had it in him that he didn't have a matric and he wanted to have a matric. And in 2012, that's how far back, but he was 60 at the time, he went to a community college in Soweto. And that is where he obtained his matric. Now, certainly he did not need that matric to advance his music career because he was already famous, he was well known, he had already made it. But for him, it was a personal achievement that he wanted to have, that he still needed to have a matric. And he was assisted and he obtained his matric through a community college. And there are many more like him that our community colleges are able to provide a service to. I have covered all the questions that were asked. If I've missed anything, Honorable Chair, I'll be more than pleased to attend to it. Thank you very much.
No, thank you very much. Thank you very much, Ms. Tembisa. Honorable members, I just want to check if maybe there is any follow-up before we end our meeting. Is there any follow-up from
Minifikisela tati akabona gore batani kuma la andawe. Thank you.
No, I'll do that. I'll do that, ma. Is there any other comment or issues that we need to raise with the department? If not, let me take this opportunity and thank everyone. Honorable members, the department, parliament officials, parliament streaming services, thank you very much for listening to me while I've been given this opportunity to chair this meeting. I heard Majane saying we are aged, but not our mind. We must bear that in mind, that those people are only aged, but their mind are still working very well. To the department, he who has begun a good work in you will complete it until that day, if you are ready, when Jesus Christ comes back. May the Lord of peace himself give you peace at all times and in every way. Thank you very much. Thank you very much. To the chairperson in absentia, I want to thank him for giving me the opportunity of chairing this session. Thank you very much, honorable members, and thank you very much.
Viva Chair, viva! Viva Chair!
No, viva Mama Ngai. I think whatever we have listened today, starting from SAPS to the Department of Higher Education, is going to assist us, also the community, in responding or in amending the Older Persons Amendment Bill. Thank you very much. May God bless you. I thank you.
Thank you, Chairperson. Thanks to the
Thank you,
honorable
Chairperson.
members. Thank you, everyone.
Thank you so much.
Lindy, is there something?
Thank you.
No, Acting Chair, we've concluded all the items for discussion.
Thank you so much.
Thanks, ma'am.
Go and enjoy your
Enjoy your weekend.
International Women's Day and take care of yourself. Thank you.
You too, Chair. You must take care.
Thank you. Thank you, Ma. I'll do so.
I will end the meeting for everyone. Thank you.